Greetings. If you are tuning in, you are watching the 2023 Virtual Benefits Open Enrollment Health Fair for non-contract AFSCME and Teamsters employees. Just a few items of housekeeping. Today's Virtual Open Enrollment Health Fair was pre-recorded and will be made available for review and reference following the event. If you have any questions, please contact the team at humancapdev@metro.net. We want to hear your feedback, so please submit a virtual evaluation following the presentations that you watch to be entered into a raffle. After each presentation, you will be allowed the opportunity to enter yourself into a raffle for a fabulous prize by scanning the QR code that is on the screen and providing us with your very important feedback. We do ask you to provide your name, badge, and your evaluation in order to be entered into the raffle. You might be wondering, when are we going to hear about this raffle and who is going to pull those names and when will I get my prize? Well, we have two information sessions lined up for you. On Wednesday, November 8th from 11 to 12 p.m. on Microsoft Teams, and on Tuesday, November 14th from 1 to 2 p.m. on Microsoft Teams, we will have a live information session and a live raffle. You do not need to be present in order to win a prize. Please, if you can join us, you are welcomed. Please refer to your Metro email and Outlook for the invite. Today, you'll be hearing from a variety of folks, including Althea Bovell, Deputy Chief Civil Rights Officer, Jan Olson, Deputy Executive Officer of Pension and Benefits. Jackie Daniels is an Assistant Administrative Analyst in Pension and Benefits. My name is Nick Arevalo Parrish. I'm the Project Manager of Employee Engagement, and Davion Pearson is our Senior Administrative Analyst of Employee Engagement. All of us collectively work together to put on this event for you today, and we hope you enjoy. Without any further ado, I'd like to introduce you to Althea Bovell for welcoming comments.
Welcome to our virtual health fair and annual open enrollment. I'm Althea Bovell, the Deputy Chief Civil Rights Officer. This year's program is entirely pre-recorded, which is a new format for us. We encourage you to provide feedback after the event to help us improve the format in the future. This program is designed to provide employees with tools to improve and maintain their health and make informed enrollment decisions. In the current post-pandemic recovery, focusing on our health and well-being is more important than ever. Please take this opportunity to learn about benefits, submit your questions, attend the informational sessions, and utilize the resources provided. I'd also like to extend my gratitude to the dedicated team members who made this program possible, including the Pension and Benefits team, Employee Engagement, and the IT team. Our healthcare colleagues have generously shared their time and expertise to be with us today. Throughout the program, you'll have the chance to hear from professionals on various health-related topics, covering mental, physical, and financial wellness. We'll also be asking for your feedback, and we look forward to hearing your thoughts. Enjoy the event, and now I'm handing this back to Nick to introduce the next speaker. Again, thank you all for participating. And once again, a big thank you to the team for making this virtual fair possible and always presenting a great experience for our Metro employees.
Thank you so much, Althea. Next, folks, you'll be hearing from Jan Olson, who is the Deputy Executive Officer, DEO, of Pension and Benefits. Jan, the floor is yours.
Good morning and welcome to the annual health fair. I'm Jan Olson, the Deputy Executive Officer with Pension and Benefits Department. As Althea just mentioned, we have a lot of great information to share with you today. But before we get to that, I want to talk a little bit about open enrollment. The online system is up and running, and you can access it through your FIS login or at benefits.metro.net, where there are easy to access resources on the landing page. These resources include login instructions if you need them, an open enrollment user's guide, forms and brochures, website links, and benefit enrollment guidebooks. These guides include many tips and tools to help you get the most out of your benefit plans and maintain or improve your health. Just a couple reminders. It is very important that we update our beneficiaries if we've not done so recently, and there are links to the beneficiary form included on the site. Please follow the directions on each page of the open enrollment system, paying particular attention to notations that are marked in red. One of the first screens that you will see lists your dependents and beneficiaries, and we ask that you do not attempt to change beneficiaries on this screen, as some may be included as they are listed as contacts in another area of the system. There is a screen dedicated to beneficiary changes as you proceed through the system. Most of your elections will carry over to 2024. However, there are plans that require an election each year. Those are the non-tobacco users' life insurance, healthcare and dependent care flexible spending accounts. And please remember that the dependent care flexible spending account is for daycare for your children. The WAVE Medical is another important benefit. Please don't forget to submit your proof of other coverage so that you can receive the WAVE credit back into your paycheck. One last thing on this system is to print and save your confirmation system. And you may see two warning messages at the top. One will say required, which means you will need to take some type of action. And the other is optional, and there's no need to worry about this one. No action is needed. More information is coming. Open enrollment information sessions will be on Wednesday, November 8th at 11, and on Tuesday, November 14th at 1. Additional email communications and reminders will be coming out, so please watch for those. And open enrollment closes on Sunday, November 19th. This is your opportunity to review your benefit plans and make sure that they meet your needs and those of your family. Again, thank you so much for joining us today. And now I will return this back over to Nick. Thank you.
Thank you so much, Jan. I appreciate you. All right, folks, we're off to the races.
Good morning, everybody. My name is Celso Ramos with Delta Dental, and today we're going to be talking about your benefits overview with the MTA Public Transportation Service Corporation. Next slide, please. And today we're going to be learning about your plan options that you have with the MTA. Next slide, please. So we can see we do have compare your options, which is the PPO and the Delta Care USA. For the PPO option, you can visit any dentist. You can also save money by staying in a network. You also pay a percentage of the coverage of the plan. There will be a deductible and maximums when they're applied. For the Delta Care USA, you usually choose the primary care dentist from the Delta Care Network, US network. With this plan, you pay set co-payment for the procedures, and there's no deductibles or maximum when you choose Delta Care USA. Next slide, please. So let's go over your Delta Dental PPO plan. Next slide, please. So as you can see in this slide, there's three types of dentists out there with this plan, which is the Delta Dental PPO. The middle one will be like a Delta Dental Premier Dentist. And the third one will be a non-Delta Dental PPO. We do have the cross on the third one because that's the non-Delta Dental PPO. That one, you cannot save that much money. For the other ones, the PPO and the Premier, most of that one that you save more money will be on the PPO network. Some dentists are staying on the Premier, so that you can still save money, but their price is a little bit more affordable than the non-Delta PPO. Next slide, please. So let's go over the breakdown where your PPO coverage, what does cover. So as you can see in the slide right here, you are covered 100% on the diagnosed and preventative, which is, exam, x-rays, and cleanings. Your deductible, it will be exempt only when you just go for a checkup and regular cleaning for the in-network. For the basic and endodontics and periodontics will cover, and oral surgery will cover 90%. And for the major restoration services, such as like crowns, will cover 60%. Regarding about the implants, also will cover 60% until you reach your maximum, which is at 2,500 per year per person. And for the orthodontia dependent children's and adults, it will cover 50% until you reach your lifetime orthodontic maximum, which is 2,000 per person for the in-network. As you can see on the last column is a non-out of network. It still covers most of the procedures, but you're reducing yourself, such as like a basic endodontic and periodontics, 10%, and 10% on the crowns and implants. Also, the deductible will not be exempt if you go out of network, which you will pay a $50 deductible per year or $150 for the family. Next slide, please. So we got you covered with this plan. With this type of plan, you don't need an ID card to check in. We also, you can use it if your partner or domestic partner will have other insurance, we'll coordinate it, dual insurance, so you can use both at the same time. You just have to let your dentist know that you have dual coverage within another carrier or another company with your other person on your family. You also can, we like you guys to create an online account to check the benefits, and also you also can check your claims online. Next slide, please. And let's go over a pre-treatment estimate. This is so easy and simple to about expensive. What does this mean? This means when you go to a dentist and you're not sure what's going on with the billing, or why they're charging you more than what they're supposed to be charging. If you're clueless or you don't know what's going on, we recommend you guys to to stop and then let the dentist know, or the staff, that you want to get a pre-estimate, which is simple by 3 different steps, which is you ask your dentist for the estimate. Number 2, the dentist will send the details to us. And number 3, you and the dentist will receive a cost estimate to make sure you guys are in the same as kind of like what's going on with your copay, or how much you have to pay. This is recommended when you have to pay more than $300 and above. Next slide, please. And let's go over the Delta Care USA, which is the HMO plan. The next slide, please. So for this plan, it's a comprehensive coverage, which is a prepaid fixed copayment plan. Once you enroll, you will select the primary dentist on a Delta Care USA network by enjoying, these benefits. Sometimes the Delta Dental will set you up a dentist if you don't have one. But one of these recommendations for this plan, if you're not happy with your dentist, you can call us and we can switch your dentist, but you have to be assigned to the dentist that takes this type of plan. With this plan will be a set co-payments. There's no annual maximums, there's no deductibles, and there's no claims. And basically you get low premiums with this plan. Next slide, please. How does this USA works with this dental plan that we have? Is that dental care is easy, which is 4 different easy steps, which is number 1, you will choose your primary care dentist online or by phone. Number 2, you will make an appointment. Number 3, once you visit the dentist. And on number 4, you will pay a copayment if there's any copayment at that time. Next slide, please. And then basically, if there's a specialty or an emergency care, Delta Care USA, you will need a primary dentist to refer you, a referral form. Also, your primary care will request you guys authorization for any specialty services in case the dentist that you are assigned are not able to do those services. And with this plan includes out-of-network coverage for any type of emergency. So make sure you guys follow the procedures when the dentist tell you that they're out-of-network. But if it's an emergency, will be covered. Next slide, please. And how to choose your dentist with Delta Care USA? It's simple. You just go to deltadentalins.com to browse the Delta Care USA dentist in your area. You can write down the facility number, which is easy will be shown on the page of the primary care dentist if you like. And you will submit your request. You can do it online when you create an account at deltadentalins.com, or simply by calling the customer service number right here in the slide, which is 800-422-4234. Next slide, please. And then switching from another plan from Delta Care USA. With this plan, what cover begins when your plan starts. If you have any pre-existing conditions or missing teeth are covered with this plan too, such as, for example, if you're undergoing an orthodontic treatment, you may also be stay with your current orthodontist in case you have this plan. Next slide, please. And let's go over the web and mobile resources. Next slide, please. For this type of services, you can check out our website, deltadentalins.com. It's simple. You can search for any such as networks dentists in your area. We will recommend you guys to create an online account, which is you can also print your ID card from there. You can also check your plans such as eligibility, coverages, services, and level of benefits. You can also submit any customer service questions. And also we do have a feature that you can subscribe with Green, which is a quarterly wellness e-magazines on this type of feature with the website. Next slide, please. We do also have a mobile app. You can scan the QR code right here in the slide. With this mobile app, you get as much as you can with like the website. You can find a dentist. You can also get your electronic ID card, like mobile when you go to the dentist. You can also get your cover details, and also that one I was talking about earlier, which is the cost estimate. You can also do it on the mobile app or either the website. To find an app, just basically at the Apple Store or Google Play, you can just search Delta Dental. You will download it there right there for any Delta Dental plan associations. Next slide, please. And we also encourage you guys, we do have some features online, which is called Rush Mart, a free oral wellness program exclusive for only you Delta Dental members. With this type of services, with this discount member that can sign up and receive immediately access for special offers, such as, Sonicare or Oral B products. Also, we do have a wellness education resources you can, share with you and your family. By simply sign up, just visit brushmart.org. Next slide, please. And any questions after these presentations on when you're at the dental office with any type of plan that you choose, this will be the customer service to help on phone or online. For the PPO option, you can call at 888-335-8227. They can help you Monday to Friday, 8 a.m. to 8 p.m. Pacific time. We also have an automatic telephone system, which is 24/7. For Delta Care USA, it's a different number, which is 800-422-4234. And they are Monday to Friday, 5 a.m. to 6 p.m. Pacific time. And also they have an automatic telephone system, which is 24/7. Or you can go online, which is at deltadentalins.com if you have any other questions. And thank you for your presentation, for your time. And any questions you can, submit it to us, or you can call us at the number. Thank you.
Thank you for participating in this presentation. We'd appreciate your feedback. Using your smartphone camera, scan the QR code and follow the link to our evaluation. Submit your name, badge, and evaluation to be entered into a raffle. Here are the rules. 1 evaluation/raffle entry per employee per presentation. Winners will be selected at the upcoming information sessions.
Okay, good afternoon. This is Liliana. I am from Dental Health Services, and I wanted to go over all of your all of the open enrollment items that you might have questions on or might need more information about. Just to go over a few items, these are the table of contents of what we will be discussing today. We will be discussing open enrollment, information about your plan, what you should know about the plan, how to select the participating dentist, the importance of healthy gums, and preparing for your dental visit, as well as questions about your benefits. Let's start with open enrollment. Dental Health Services is proud to continue offering you and your loved ones dental benefit solutions and excellent customer service. Your open enrollment period allows you the opportunity to enroll and make changes to your current policy, such as adding or deleting dependents. This is definitely when you want to take the opportunity to do that. To do this, visit Oracle/FIS responsibilities. Click on Benefits Open Enrollment to begin the open enrollment process. Select the dental plan option you would like by checking your corresponding box in the select column. Information about your plan. Dental Services offers you a great plan with wonderful benefits. There are no deductibles, no maximums, and no waiting periods. Please consult your schedule of covered services and co-payments for a full description of your covered benefits for specific services, exclusions, and limitations. You're responsible for any co-payment or any remaining balance due to your participating dental office. Your plan also covers specialty services for the same co-payments. If your specialist service are needed, your participating dentist will submit a specialty referral to Dental Health Services for pre-approval. If the referral is an emergency service, your dental office will contact Dental Health Services to obtain authorizations over the phone. Orthodontia braces are covered under your plan for children and adults. Please contact Dental Health Services directly for a list of contracted orthodontics in your area. What you should know. There are many diseases or conditions that manifest themselves in your mouth. Vitamin D deficiency, diabetes, lupus, and tuberculosis are a few examples. Research has also shown that there is a connection between gum disease, the plaque and tartar in our mouths, and heart disease, especially for those who smoke and consume alcohol. Routine oral cancer exams by the dentist can prove to be a life-saving practice. How to select a participating dentist. Under your dental health service plan, you must select a qualified assured dental office from a list of participating dentists. You can also visit our website at dentalhealthservices.com to select or change your dentist. You also have the split facility option, which allows you to select multiple participating dental offices for each of your family members. You can change dentists monthly by simply contacting one of our member services specialists at 800-637-6453. Requests received by the 15th of the month will be made effective on the 1st of the following month. The importance of healthy gums. Why do gums bleed, and what does that do to your body? Any bleeding means that there is an open blood vessel. The very small blood vessels in the gums are capillaries. They bleed when the body is fighting the inflammation caused by plaque. Plaque is bacteria, and these germs, if not removed or controlled by proper brushing and flossing and regular and timely dental cleanings, will do more damage. The scary part is that these bacteria find their way inside the bleeding blood vessels and go everywhere in our bloodstream. Brushing after every meal is not possible for most of us who have a busy life. So make it a habit of brushing after breakfast in the morning and before you go to bed. Please tell your kids about this. At least try to floss every other day if you cannot maintain a daily routine. Also, develop your own routine based on recommendations from a dentist or hygienist. Each of us have different needs, even when it comes to preventative or prophylactic care. Receiving regular dental cleanings usually indicates that you have a relatively healthy periodontal gum condition with minimal inflammation and bleeding. A 6-month interval between cleanings is accepted good practice in maintaining healthy gums. Please remember that this is not the amount of sugar or acid in a snack or a drink. It is a number of times we expose our teeth to them. Prepare for your dental visit. When visiting your dentist, we recommend that you bring a schedule of benefits with you. That is very important. And ask for a copy of your treatment plan prior to beginning treatment. Please don't sign anything if you feel that your co-payment schedule is not reflected on the treatment plan. If that is the case, please call our office. You have the right to know your dentist's recommendations for your care. If you do not understand your treatment plan or your dentist recommendations, please ask your dentist or a member of his or her staff for clarification. If you are unsure, do not sign anything you do not fully understand or agree to. Please call Dental Health Services at 800-637-6453 with any additional questions, and one of our member services specialists will be happy to assist you. Your dentist may also recommend, or you may choose, an elective treatment not included in your covered services with a higher copayment in lieu of covered benefits. These additional services are always optional, and you are responsible for the cost difference between the covered and the optional treatment. You can decline these treatments and select only those covered by the plan if you choose. For additional questions regarding your benefits, we are here to help you learn about your dental health. Please visit our resources on our website at www.dentalhealthservices.com/members/resources. Here you will find frequent questions and answers and tooth tips on a variety of topics such as risk assessments to prevent cavities and periodontal and heart disease connection. For additional questions or assistance, please contact Dental Health Services at 800-637-6453.
Thank you for participating in this presentation. We'd appreciate your feedback. Using your smartphone camera, scan the QR code and follow the link to our evaluation. Submit your name, badge, and evaluation to be entered into a raffle. Here are the rules. 1 evaluation/raffle entry per employee per presentation. Winners will be selected at the upcoming information sessions.
Great, thank you, Nick. I am happy to join you today. I'm Kathy Roche, your account manager here at VSP, and I welcome you all and appreciate your time that you have set aside to learn more about your vision and eye care benefits for you and your dependents. I hope you take away something new about the importance of eye health by the conclusion of my presentation. Why enroll in a vision plan with VSP? Well, as a health-focused company, your well-being is at the core of everything we do. Eye care is essential to your overall health. From private practice doctors to retail chain locations, VSP is here to help you with convenient access to local eye doctors. With VSP, you'll get convenient access to the personalized care you need with savings you can rely on. Next slide, please. Help keep yourself healthy with a yearly eye exam from a VSP network doctor. Even if you have 20/20 vision, it's important to get an eye exam every year. And you may wonder, what's so important about an eye exam? Well, it's because the eyes are the only place in the body that provide a non-invasive, unobstructed view of blood vessels. This allows eye doctors the ability to detect signs of conditions like diabetes, diabetic retinopathy, high cholesterol, and hypertension. Regular eye exams can reduce the risk of diabetes-related vision loss by 95%. And a well-vision exam can reveal health conditions even if you don't yet have symptoms. Next slide, please. Your plan entitles each member and your enrolled dependents to a comprehensive well-vision eye exam every year. You have the option of using your plan in-network or out-of-network. It is the in-network portion of the plan that has the richer benefits, and your hard-earned dollar will go farther. No matter where you're located, nationwide, you have a convenient access to a VSP provider. Make sure you confirm with the doctor's office that they are in network with VSP. Also, did you know that ID cards are not needed? Your VSP in-network doctor will be able to internally access and verify that you are a VSP member and will be able to access your specific benefits plan with PTSC. They will take care of the billing and no claim forms are needed. Next slide, please. There are no changes to your 2024 vision plan. Your plan includes an annual well vision eye exam with a $10 copay and a $20 copay for materials, which includes contact lenses or frames and lenses. Your plan also includes essential medical care, eye care, and this benefit allows for additional exams and services beyond routine care to treat issues such as pink eye, sudden changes in vision, or to monitor conditions such as dry eye, diabetic eye disease, glaucoma, and cataracts. These services are all available for all members with a $20 per visit copay. For members with diabetes, they can opt to receive a retinal screening with a $0 copay. Your plan offers a choice of prescription eyeglasses or prescription contact lenses. For glasses, which includes both the frame and the lens, your allowance is $150, and the frequency in which you can receive your new glasses is every 12 months from the date of your last service. The frame allowance goes up to $170 if you select a featured frame brand, and your optician will share which frame brands fall under this featured frame brand category. If you happen to choose a frame that costs more than the allotted allowance, a 20% saving is applied to the overage amount. The frame allowance at Walmart and Sam's Club and Costco is $80. Lenses for your glasses that are covered in full include single vision, lined bifocal, lined trifocal lenses, and standard progressive lenses. We all know how hard kids can be on their glasses, so take note that impact-resistant lenses for children are also covered in full. All other lens enhancements are discounted at an average of 40%. Now, if you're a contact lens wearer, the plan provides a $120 allowance to spend on the exam, fitting, and purchase of your contact lenses. Next slide, please. For employees only, there is a computer vision care benefit. This benefit allows employees to receive computer vision exam and computer glasses with a $20 copay. This is eyewear specifically designed to reduce the impact of using digital devices and has features such as anti-reflective and blue light filtering capabilities. Nearly 60% of adults report experiencing symptoms of digital eye strain, also known as computer vision syndrome. People spending 2 or more continuous hours at a computer screen or using digital screen device every day are most at risk. Most people aren't aware that they're experiencing computer vision syndrome, which may include one or more of the following symptoms: neck and shoulder pain, headaches, blurred vision, or irritated eyes. This is a great employee benefit that PTSC is offering members. Next slide, please. There are many retail chain locations in the VSP network that will allow you to use your benefits. Our retail chain providers include, but aren't limited to, Sam's Club, Walmart Vision Center, Costco Optical, and VisionWorks. VisionWorks is a national chain and has opened locations in the state of California this year, with several locations being in the Southern California area. Next slide, please. Using your VSP benefit is easy. Once your plan is effective, or if you're already a member, you can create an account on VSP.com. Here, you will be able to access your specific benefit plan information and view your claims history. Other features include the Find a Doctor tool that allows you to refine your doctor search by location or type of service. And to learn more about the exclusive member extras with savings on leading industry brands, and also include contact lens coupons. Next slide, please. We are really excited about Iconic.com, VSP's online store. As a VSP-owned company, Iconic is the only website that seamlessly connects your VSP Vision benefits to your account. By applying your Vision benefits, you see savings in real time. Iconic offers an easy and fun user experience, and you can virtually try on a large selection of frames and sunglasses. Iconic offers a variety of well-known brands and contact lenses. You can save time and money on quality eyewear with just a few steps. 1, you can connect your vision insurance. 2, you can select the glasses or contact lens products that you want to purchase. 3, you can upload your prescription or provide your doctor's contact information, and we take care of the rest. Once your glasses or contact lenses are ready, they are shipped directly to you. Next slide, please. Our goal at VSP is to help you see well and be well for a lifetime of good vision with the coverage and quality of care you deserve. To learn more, you can contact us by calling VSP Member Services or by visiting us online at VSP.com. In closing, I encourage you to schedule an eye exam and utilize the wonderful VSP Vision benefits that PTSC offers you. Thank you so much for taking the time to learn more about your vision benefits through VSP Vision Care.
Thank you for participating in this presentation. We'd appreciate your feedback. Using your smartphone camera, scan the QR code and follow the link to our evaluation. Submit your name, badge, and evaluation to be entered into a raffle. Here are the rules. 1 evaluation/raffle entry per employee per presentation. Winners will be selected at the upcoming information sessions.
Thank you, Nick. And thanks everybody for listening to the presentation. I'm going to go through healthcare flexible spending accounts and dependent care flexible spending accounts, which are both part of your benefits package. My name is Tony Cohen. I'm with the Advantage Group, and we're the administrator of these 2 benefit accounts. Next slide. So a flexible spending account, for those that aren't familiar, is just a mechanism within your payroll that allows you to set aside a portion of your paycheck on a tax-free basis to pay for things that you would ordinarily be spending out of your checking account after tax. So those things in this presentation include healthcare expenses that are not covered by your insurance, and then dependent care expenses, mostly childcare, obviously not covered by insurance as well. So anything that applies in those two categories for you or anybody in your household will be eligible to be used or to be paid for by tax-free money from your flexible spending account. Next slide. And so to use these accounts, again, for those that have not used them before, the first step you do is you estimate what you're going to spend during the course of the plan year, which starts on January 1 and runs for the calendar year. And so you'll take your expenses in the healthcare category and the dependent care category, which are two separate. You can use one or the other or both. It's up to you. And we'll go through it in a little bit, but that exercise of estimating how much you and your family are going to spend in those categories is the most important step, because then you'll just take that annual amount and divide it by your number of payrolls, and then that's the amount of money that's contributed to your flexible spending account every single payday. Again, by doing that, by putting that money into a flexible spending account, you are alleviating yourself from federal tax, state income tax, and payroll taxes or FICA taxes, which are Social Security and Medicare. So you're basically reducing your tax withholdings and keeping all of that money to go towards those expenses. Next slide. This is just a generic table of how you can estimate what your tax savings would be by using these accounts. You can always go on our website or even just which is enrollwithtag.com, or just Google FSA calculator. And there's several options out there which will allow you to put in your gross income and then what you're going to be spending in certain categories. And ours is a little more detailed on our website, which will allow you to put more tax information in there to give you a specific, a more specified, I should say, estimated tax savings, which ultimately is just an increase in your net take-home pay. So here's an example of an individual earning $50,000 a year that has an annual total of out-of-pocket expenses of $5,000 for dependent care and healthcare expenses. And this table just illustrates this individual reducing his or her taxable gross income by $5,000 and what impact that has. So since I have the floor now, I'm going to take a quick second just for those that don't live in this world. The minimum federal tax bracket is roughly 15%. So everybody, regardless of how much money you're making, you're going to be spending 15% of your income on federal income taxes. The second piece, and we live in the state of California, for all the good that it has, it does also have high tax rates. So you're looking at about 5%, and for higher income earners, it goes up from there up to 13-ish. So you're at 15% federal, 5% state, and then our FICA is the same for everybody up to a certain threshold, but that's about 8%, 7.65 to be exact. So you're right on 30% is what we all, is our threshold for taxable income. So you're avoiding that for these expenses in this scenario, $5,000. And 30% of $5,000 is $1,500. So simply by using this account for things that you're already spending, this individual is going to keep $1,500 of his or her money that otherwise would have been taken out in taxes. Next slide, Nick. Okay, so the first account, the healthcare FSA, and the Section 125, if you're wondering, is just the Internal Revenue Code that governs these types of plans. Anytime you're going to be saving taxes on something, the IRS needs to make sure you follow their rules. So Section 125 of the Internal Revenue Code is what governs these plans. The next one, which we'll go into, is Dependent Care FSA, which is a slightly different one. But the healthcare FSA, like we discussed earlier, you're simply going to determine what you're going to spend out of pocket for healthcare expenses, and we'll go into it in the next slide in a minute. But what those covers is basically anything that's not covered by your insurance that is medically necessary will be covered under your healthcare FSA. So you choose your monthly contribution, obviously enroll like you would in any of your other benefits. The big key with these benefits, and with most benefits, is you can only enroll during your open enrollment period. So unless you have some sort of family qualifying event during the year that would trigger the ability to enroll or change your contribution, this is the only time of year that you can do that. So, take your time. I encourage you to make sure that you take your time now, because middle of the plan year, barring anything major happening in your life that would trigger a qualifying event, you're not going to have the opportunity to do that after open enrollment ends. Next slide, Nick. And so when I say the term, or I use the sentence or phrase that anything that's medically necessary is covered. It really is anything that you're gonna purchase to improve you and or your family's health or take care of your family's health that's not covered by insurance. You should be able to use your healthcare FSA for that. So the most common ones are obviously out-of-pocket prescription costs, co-pays, co-insurances, any over-the-counter medications, Tylenol, Advil, allergies, first aid items, certainly all your dental expenses and vision care expenses, orthodontia. And you can go, there's thousands and thousands of items, obviously, that are going to fall into this category. On our website, you can check out a comprehensive list. And then there's a link to the FSA store in there as well, which will show you a ton of items, including discounts for over-the-counter items that you can purchase on the website. So anyway, anything that's healthcare related that you and or your family spend throughout the year, I'd encourage you to fund your healthcare FSA to pay for those. So you can save obviously on your taxes for those expenses. Next slide. Okay, so every year the amounts go up as far as what you can contribute to these accounts. This year it's $3,050 is the maximum for the plan year. The way this account works is you have access to that entire election at the start of the plan year. So say you're planning something big like a LASIK eye surgery or another event that's going to be, a significant financial event that a healthcare flexible spending account can help pay for. You don't need to wait until you save up that money in your account to pay for that event. And I just use LASIK eye surgery because typically those are high out-of-pocket costs for individuals. So say it's a $2,000 or $2,500 event, and that's all you're going to contribute that year. Well, you can elect that $2,500 and contribute roughly $100 a payday into your flexible spending account, but you can use your flexible spending account to have that entire procedure and pay for it in January. And then basically throughout the rest of the plan year, your contributions will simply pay the plan back. So that's nice for those that are putting off dental procedures, again, LASIK eye surgery, any out-of-pocket expense that's going to cost up front. You can get that done sooner than later and then pay the plan back throughout the year. On the flip side of that, these plans do have something called the use it or lose it rule. And so what that means is if you don't use it, you risk losing it. And so you want to make sure that what you are going to contribute to the plan is something that you do plan on spending. And so the way that works is if you elect, say, in this case, say you maximize your contribution at $3,050 for the year, but come, December, you've only spent, $2,500, you're going to have $550 left over in that plan. So the next bullet point is a grace period, which allows you have 2.5 months to incur additional expenses. So that gives you through March 15th to incur any new expenses, March 15th of 2025, that would be, to incur any expenses that you didn't use during the 2024 plan year. That way you don't lose any of your money. So that grace period does give you a little extended time to incur expenses in case you don't use your annual election, but just avoid it, by being mindful when you do make your contribution. Just don't contribute everything just because you think you might spend it. A little bit of preventative exercise during elections will alleviate most of those issues. So anyway, the last bullet point, the run out period, is simply it's a 90-day run out period, but it overlaps with the grace period. So those terms can get confusing for those who haven't used it before. If for some reason you end up having money left in your account, the grace period is the time to use that. If for some reason you didn't use your tag benefits card, which we'll cover in a few slides, and you actually had an out-of-pocket expense that you paid for with your checking account or normal credit card, you submit for reimbursements. If you didn't do that during the plan year, the cutoff for that is the end of the run out period. So that's through March 31st, and that would be in this case, 2025. So all these dates are the same for this plan year, that, our 2023 plan year. You're just going to apply them to the appropriate year that we're in. So that's the grace period and the run out period. Make sure you understand those. That way you avoid the user or loser rule. Next slide. All right, so dependent care is similar, but there's a couple key differences which I'll highlight. Nick, next slide. The process of enrolling is the same. You determine your applicable dependent care expenses, and that will divide those for the year, and then divide those by your monthly payroll cycle, and that will be your election per payday. Again, you can only do this during open enrollment. Now, if you do have a child that phases out age-wise, that is an additional qualifying event. But the same concept applies. Unless you experience a qualifying event, your election is locked in for the year. Next slide. Again, this is for 13 years, or I'm sorry, basically 12 years and under, as far as childcare expenses go. So before school, after school camps, summer camps, any babysitting services that allow you and or your spouse to go to work or school qualifies here. This last bullet point for those that may or may not have these is often overlooked, but shouldn't be. If you claim you and or your spouse's parents as a dependent on your tax return, and you pay for their services any way, shape, or form, that is going to be an eligible expense under the dependent care FSA. So the majority of folks that use these accounts do have young children and pay for childcare. That's what these accounts are primarily used for, but they can also be used for elder care services. Next slide. And this one's important because it is a larger amount. You can contribute up to $5,000 per year per household. And so what that means is if your spouse works for another organization and has access to one of these accounts, it's only $5,000 per year per household, not per individual. So just be mindful that's how that works with your tax returns. The key difference with dependent care accounts is they're only available to what you've already contributed. So the example I gave earlier with the LASIK eye surgery would not apply to the dependent care FSA. It's only what you've already contributed is what you'll have access to use when you pay for childcare services. The same use it rule applies, and then the same grace period and run out periods as the healthcare FSA are exactly the same. One key note for those that may be married but filing a separate tax return from their spouse, Internal Revenue Service cuts your maximum contribution to $2,500. So be mindful of that if you're looking into that. Next slide. Okay, so using your account, there's two primary ways to use it. Now, the first and most convenient is going to be you get issued a tag benefits card. So right before you start your plan year, you'll receive a welcome kit in the mail, which will have a card in there. That'll be if this is your first time enrolling, you're obviously going to get a new card. For those that already have it, your current card is good for three plan years. So it will expire after the third plan year, and you'll get a new one in the mail automatically. That benefits card comes in with other information as well, but it comes in from a bank issued envelope. So it can look generic. So just be on the lookout not to toss anything out. Should you have a problem with that, either log on to our website or log on to your online account and or call our office to get that card reissued. But that's the first way to use your flexible spending account. These are smart cards. They're coded on the back end to know what you're purchasing and where you're purchasing them at, and pull from the appropriate account. So if you're at obviously the pharmacy, it's going to recognize that you're at an applicable vendor, understand that you have X amount of dollars in your account that's available towards this purchase, either approve or deny it at point of sale. So that's the most convenient way to use these accounts, is just use your tag benefits card at point of purchase. It'll pull it directly from there. Now, some folks, especially those that do max out their elections, prefer to get credit card points by using their regular credit card, or you just simply don't have your tag benefits card with you, or whatever it might be. In that case, you'll just pay for it like you normally would, and you'll submit a request either through your online account or through our mobile app. Either or is very easy. And then in that case, you choose if you prefer to have a direct deposit or a mailed check to your house. There's no charge for either of those. So you whatever's easier for you is how we'll process that reimbursement. And those reimbursements get processed in coordination with your payroll cycle. So those are the two ways to access the money that you put into your flexible spending account. Next slide, Nick. Okay, and this is just a screenshot of what the login looks like. Once you're in there, it's very similar to a traditional bank account. You view all your account activity, deposits, credits and debits, submit claims, set your communication preferences. How often would you like to be notified about account balances? If and when you need to submit a receipt so we can verify an expense, things like that are all done on there. And then if you do have a dependent care and a healthcare flexible spending account, both of these accounts will be viewable in your online account. Next slide, Nick. Now be on the lookout for additional material from your employer. It'll look something like this with FAQs attached to them and all that good stuff. But there's additional information in there. A lot of that stuff can be found on our website as well. So I encourage you to go there if you're looking to learn about more information. And then next slide, real quick, Nick. This last slide on participant services. So this is, if you do have questions, ignore that bottom total expenses. That looks like a typo. I apologize about that. And you just want to talk to somebody, because you can always email us or visit our website for electronic communications. But if you want to talk to somebody about, especially if it's your first time using a flexible spending account, we have folks that are qualified that can help you, walk through that election process or answer any specific questions about anything that you may have to do with contributing to a flexible spending account for the first time. What happens if a certain event happens in your life? Are there certain expenses that you may aren't sure if they're covered? All those types of things. Our service team's great, and they're there to help you if you need them via live phone support. So all of our service team is located in Southern California. So you when you log in, they're on the same hours that you are, or when you call in, I'm sorry. So our standard business hours are similar to a bank, 8 to 5. There are after-hour service support as well. And I encourage you to lean on those folks if you do have any questions during open enrollment. Next slide, Nick. And that should do it. So appreciate you guys taking the time. Don't be a stranger. Should you need any help, feel free to reach out directly with anything you need.
Thank you for participating in this presentation. We'd appreciate your feedback. Using your smartphone camera, scan the QR code and follow the link to our evaluation. Submit your name, badge, and evaluation to be entered into a raffle. Here are the rules. 1 evaluation/raffle entry per employee per presentation. Winners will be selected at the upcoming information sessions.
Hi, my name is Kurt Kemp. I am a national accounts consultant at The Standard, working with your group. And today we're going to talk about your life and disability benefits. So next slide. Currently, as being employed, you currently have benefits that you can choose between life insurance and long-term disability insurance. And I'll explain a little bit about your plans as well as some of the details. Next slide. But before we start talking about the life and long-term disability, wanted to give you a little bit of information about the Standard. We have been in the non-medical space, which is life and disability, since 1906. We have a solid rating with the various bureaus showing that we will definitely pay claims when it matters most. And really is making sure that we are going to be focused on your needs when you become disabled or deal with a death in your family, to make sure that we're taking care of everybody well. Next slide. So first, we'll start talking about life insurance. Next slide. The mentality behind life insurance is that if you were to die or someone in your family were to die and had life insurance coverage, life insurance would provide help with any childcare costs you may have, any housing costs, college tuition, just basic daily living expenses, and as well as the obvious funeral expenses. But the goal with life insurance is to make sure you feel you have enough in case you, as a primary breadwinner in your family, if you weren't able to make money, those bills don't go away. So is to be able to plan a little bit to help handle the tough time of not being there anymore to take care of your family. Also, as part of the life insurance plan, we do help with travel assistance, which we'll talk about in a little bit, as well as some life services for both you and your beneficiary that you choose. Next slide. So as part of being employed, you will have some basic life insurance provided to you, but also a chance to purchase additional life insurance. But the whole idea is how much would it take for me to handle or to leave my beneficiary if it mattered? And then how much does it cost? And so if you were to die today, what would that mean for who you're leaving behind? And the idea with life insurance, this plan is term life insurance. So that means that it's the cheaper life insurance option, meaning that you pay for the benefit and then you will get a death benefit. So it's a pretty basic type plan, which is traditional in group insurance. Next slide. So now I'll talk a little bit about your plan, and there are different classes that you may fall into as an employee. So the first class is a non-represented or ASME employee working 40 or more hours per week. The benefit amount is 1 times your annual earnings up to the next $1,000 of benefit. And then the minimum benefit is $30,000. The maximum benefit in the plan is $400,000. So this is 100% employer paid, so it's provided for this class of employee, and you do not need to enroll. You are automatically enrolled in this plan. The second classification is for International Brotherhood of Teamsters working at least 32 hours per week. Your plan is also 1 times your annual earnings up to the next 1,000. The minimum benefit for this plan is $25,000, and then the maximum benefit is $400,000. This is also 100% employer paid. You do not need to enroll. It's provided to you, and it's also all guarantee issue, meaning that there's no medical evidence required. So from your standpoint, make sure, I always like to recommend that you update your beneficiary information if anything changes. A common example is if you have gone through a divorce and you want to change that beneficiary to a new spouse, for example, or to children or a different type of beneficiary, that you do that. Otherwise, at time of claim, we're going to be paying out based on what you've chosen. Next slide. The third classification of employee is transportation communication union employees working at least 32 hours a week, as well as amalgamated transit union employees working 32 hours a week. The benefit amount for this class is $30,000 flat benefit. The premium contribution, so for the first 2 years of your employment, you are responsible for paying the cost of that, and after that, the benefit is paid by your employer. So you do not need to enroll in this. It's automatic. The fourth class is the United Transportation Union employees working at least 30 hours a week. The benefit is a flat $25,000 benefit, and the same premium stipulation applies to you as the prior class. So it's employee paid for the first 2 years, and then after 2 years, the company pays for it full. So there's no enrolling in this as well. And another reminder is make sure you update your beneficiary. Next slide. So that's what we call basic life coverage. Now there's also additional life coverage where you can add more coverage if you feel you need to leave a benefit behind for a beneficiary. And this will apply both for members as well as dependents. So here's some basic information about the plans. Employee classification for being able to add more life insurance. So a non-represented or ASME employee working 40 more hours per week, you can choose 1, 2, 3, or 4 times your annual earnings, rounded to the nearest dollar. Minimum, maximum amount. So the maximum benefit that you can enroll in is $750,000, but there is a combined maximum between your basic coverage that we talked about before and your additional coverage of $1 million. This additional life plan is fully paid for by the employee. So this is something that you would pay for and you would need to enroll. As a new hire, there is a guarantee issue of $350,000, but if you have not elected in the past and you have been here for more than 31 days, you would have to provide evidence of insurability and go through medical questions in order to get approved for coverage. The other class is for additional life is United Transportation Union employees working at least 30 hours per week. You can enroll in an additional $25,000 benefit, a flat benefit, and this is also 100% employee paid, and you would have to enroll in this and provide evidence as well. Next slide. As part of adding coverage for yourself where you're paying for it in additional life, you can also choose to add a spouse or child. So if you feel you want to cover your spouse for life insurance in case something would happen to them and then leave the benefit to you, the benefit's 10,000 units up to 500,000. And then the guarantee issue for that is 10,000. So that means if you have a new spouse, they would be able to, you'd be able to enroll your spouse in $10,000 without evidence. If you have not enrolled a spouse that you currently have within 31 days, then you would need to provide evidence for that spouse. Premium contributions, this is all paid by you, the member, and you would need to enroll your spouse in order to have this coverage. For children, it is simply a flat $10,000 benefit if you choose to enroll a child. The cost is the same whether it's one child or multiple children. Premium contribution is 100% employee paid. There is no evidence or medical questions required for children at any time, but you do need to enroll the child in order to make sure that the coverage is being tracked. Next slide. As part of this service, the standard also provides some extra tools and benefits. So for participants that have life insurance, we do have a website you can go on, and it provides some basics of estate planning assistance. When someone is dealing with what's going to happen in the future and what would happen if you would die or one of your family members would die, most people don't do a lot of pre-planning to think about it, and understandably so, right? It's not a very fun topic. It's a hard time, but we do provide some tools and services. So estate planning assistance, funeral arrangements, help with identity theft protection or prevention. Sorry, it's not a plan when you enroll, but it's more just what do you need to think about? Financial planning, and then also health and wellness and what happens. If you do, if you have life insurance and you're a member and you were to pass away, you would list your beneficiary, and we would at that time automatically provide information to your beneficiaries regarding grief support, any legal services that they may need, financial counseling if they choose, support services or online resources that they may want to look up in case they have no clue where to turn or what to do in that situation. So we do provide a lot of free services that you and your beneficiaries can access at a tough time when it makes sense. Next slide. We also provide a emergency travel assistance benefit for members. This is not travel insurance. It's more the focus of this type of benefit is to be able to call somebody in case there is an emergency as you're traveling. So some basics of the plan. It's available 24/7 through one of our vendors. It applies if you're traveling more than 100 miles from your home, up to 180 days for business or pleasure. So this could happen while you're at work, or if you're traveling for work, or if you're on vacation. It provides coverage for you, your spouse, and kids through the age of 25. And then there is a mobile app. In the old days, there is a brochure that's available. Also, you could cut that out, but the mobile app, with everybody having phones these days, it provides you access automatically with that as you're traveling. So I would highly suggest everyone update it. But again, it provides other type benefits like repatriation of remains. It also provides emergency and medical evacuation. If you need help, you can call our vendor and they'll help you with that. Help with figuring out how to replace lost medications, finding a doctor if you have no clue how to find one where you're at. Those are just some of the basic examples of what emergency travel assistance can help with. Next slide. Now that I've talked about life insurance, I will switch over to long-term disability insurance. Life insurance provides a benefit if someone passes away. Long-term disability insurance provides a benefit for people who aren't able to earn an income, but still have expenses that they have to pay for while they're dealing with trying to get better from having a disability. Next slide. So why choose it? Disabilities happen more often than we realize. You may know someone that's suffered from a disability. The top 5 causes of disability claims are basic things like bone, joint, or muscle disorders. A lot of back conditions are a very common disability. That can happen from really poor posture from sitting at a desk or doing, some pretty hard manual labor. It can happen to everybody. Cancer is a common one. Mental disorder, especially with what everyone's been dealing with COVID and trying to navigating a new world, and then also cardiovascular, heart, lung issues where it is making it difficult to work and be productive. Next slide. So long-term disability, you do have 6 options you can choose from, and this is something that a member can enroll in and pay for. Option 1 is you can enroll in 50% benefit percentage, meaning 50% of your wage up to a maximum of $5,000. There's a 180-day benefit waiting period, meaning that you would have to wait 6 months and be disabled for 6 months before a benefit will be payable. Option 2 is sorry, I'm having a hard time seeing this. A 60% benefit up to $6,000 with a 180-day elimination period. Option 3 is a 70% of your income up to $7,000 with a 180-day elimination period. And then option 4 through 6 are similar, but it's a shorter benefit waiting period. So option 4, it provides coverage up to 50% of your income up to $5,000, and it only has a 90-day or 3-month elimination period. Option 5 is a 60% benefit to $6,000 with a 90-day elimination period. Option 6 is a 70% benefit up to $7,000 with a 90-day elimination period. Each one of these options has a different cost associated with it. So you would definitely have to look at your enrollment system and find out how much these differences are. And also, if you don't enroll as a new hire, you would have to provide evidence of insurability to enroll in this benefit as well if you are not newly eligible. But you have a lot of options, and I don't see a 70% benefit very often these days with most groups. So there's some good benefit. You can definitely choose what option's best for you. Here's some other specifics of the plan. It does provide coverage. So if you become disabled, we will look at your own occupation, meaning what type of training you would have had to do, your specific role and job for the first 36 months of a disability. Commonly, you often see 24 months. So that means that we're going to look at what you're doing from a job perspective, specific to your role and what you do when we're looking at if you can be approved for a disability where you can't do the material conditions of your job to be able to do it and be comfortable. Also, once approved for disability and you become totally disabled, disability can pay out through your normal Social Security, normal retirement age. So this can definitely provide a safety net for you if you weren't able to work for a long period of time. If you and long-term disability does provide for coverage if you become disabled due to an accident or due to an illness. And so both of those situations occur commonly in life. And so this provides an added level of protection that takes you through Social Security, where you would be eligible for Medicare or Social Security disability. Next slide. Keep in mind that all of these plans do have exclusions, limitations. Life insurance can have a reduction of benefits as you get older. As we stated with long-term disability, it does end at your Social Security normal retirement age, but you can definitely consult the benefit summaries and enrollment materials provided to you for the specific information, as well as I know there's employee certificates from a group perspective that provide general information in your plan. Next slide. So thank you for joining me in this presentation, and hopefully this gives you a nice snapshot of your benefits that's provided to you from the standard. Thanks for your time.
Thank you for participating in this presentation. We'd appreciate your feedback. Using your smartphone camera, scan the QR code and follow the link to our evaluation. Submit your name, badge, and evaluation to be entered into a raffle. Here are the rules. 1 evaluation/raffle entry per employee per presentation. Winners will be selected at the upcoming information sessions. It looks like our recording has started and the floor is yours.
Okay, thank you. Hello, everybody. This is Myron McLeod. I am the fitness director for One Fitness, which is the Metro Employee Health and Fitness Center located on P1 of the USG building. We're located directly across from the stationary storeroom on P1. So if you come in the USG building, P1, right when you exit the elevators, you'll see double doors that say stationary. Use your badge reader for that badge. Tap that badge there, that badge reader, and the doors will open for you. And you'll see the fitness center just up at the top of the ramp that you go up. We are there Monday to Friday from 5 a.m. to 8 p.m. and we're closed weekends. All right. It's free for all Metro employees. The One Fitness Center is, and but you will have to complete a registration form. Because that's going to include a waiver in there. You know, anytime you're doing any type of physical activity, you know, you got to sign a waiver. So for liability purposes. Then your badge information is sent to General Services, and they in turn activate your badge for access into the locker rooms. We have men and women's locker rooms. If you want to see a copy of that registration form as well, you can go onto the SharePoint in-system at the in-system website for Metro employees. That you can find a copy of the registration form there. You can fill that out, but we ask that you actually bring it by the fitness center and drop it off there. That way you can see where you are. You can locate the fitness center and see where you are, and you'll know how to get there. So that's your that'll be your process for registration. Hopefully that answers any questions for that. This is a great amenity to have here on site for employees. There's always a fitness specialist on staff that's there on site in the fitness center, so they can assist you with anything from getting set up on machines, questions on anything with the fitness center, getting locked out of your locker. We assist with that. We also can assist you with just general gym orientations. You know, if you bring in a group of people, if you want to just look around the gym, we can show you around the gym as well. But there's always somebody on staff there to help you out with anything you need to assist you while you're there working out. So we think that's a very good quirk to have there, having an employee fitness center. Next slide, please. So I wanted to just quickly go over really quickly some of the importance of being physically active or using the fitness center. You can see your cardiovascular health can benefit from it. Any type of cardiovascular activity is going to make your heart and lungs function better and stronger. Working out will help you do that. Weight management. If anybody out there is trying to manage weight, whether that's losing weight or gaining more muscle and losing fat, weight management also comes under that umbrella as something that The fitness center or working out and using the One Fitness can help you out with managing your weight. Bone strength also is increased with physical activity and working out. Any type of weight bearing exercises, you're conditioning your bones to stay stronger when you put those demands on your body. So that's something that is also good. Lowering our cholesterol, you know, we got your 2 cholesterols, you got your HDLs and your LDLs. If anybody is struggling with, you know, trying to regulate cholesterol levels, working out, you've heard this before, but working out can definitely assist with that, along with, of course, consulting your doctor with anything that you are going to start doing to control your cholesterol. That leads us right into blood pressure too. That's also something that can be regulated and controlled through physical activity, through working out. So these are just some of the benefits right off the bat for just having your employee health and fitness center here on site that we can help you out with, or advise you on workout routines that you have in mind. Of course, under the advice of your physician if you're experiencing anything like cholesterol or blood pressure problems. Next slide. And then we're going right into, can't see the top of that slide. So helping you sleep is also another benefit of exercise and being physically active. You know, sometimes you even have problems sleeping. Studies have shown that working out, keeping your physical activity up can help you with sleeping more and sleeping better. Anti-aging, of course, anything from helping your blood circulate better, keeping your lung and hearts in condition is going to help with the anti-aging of your body. And of course, these last two that are on here, the stress and job performance, are really, really important, and ones that we like to emphasize when we have employee health and fitness centers, especially ones that are on site. Of course, every job has a certain amount of stress, and being physically active, working out, can help reduce the stress, help you, deal with the stress more, because you can come into the gym, fitness center, take your mind off your work for at least 30 minutes, 20 minutes. You know, you can come in and work out, you can come in and walk, you can come in and stretch out. Anything that's going to take your mind off the job to help reduce stress. And of course, job performance, anywhere from, keeping you active and alert on your job, helping you, stay strong when you're sitting long periods. All of that stuff comes under job performance, So again, the sleep, the anti-aging, stress, and job performance are also benefits of working out and keeping your body physically active and using the fitness center. I just kind of wanted to highlight those benefits of exercise. You probably have heard all those before, but it doesn't hurt to get reminded of those. It's going to get you down to come see us in the fitness center. Next slide. So I already went over the hours with you. This is a slide showing you what the amenities are and what we offer there at Metro One Fitness on P1 of the USG building. There's a towel service. There's towels that are located at the front desk. You grab a towel to work out. You can also use that, grab a towel for showering. Our locker room has showers. We have daily lockers in there that we try to get everyone to use and bring their stuff down, and you can use your locker for 2 hours. And there are no locks required. It is a personal combination that you yourself will put in to the lock. Scramble it and close your locker, and you come back to it and use your own personal code. So there's no need to bring a lock for your locker there. We already got that taken care of for you. If you are visiting from other divisions that are not, that are not here in the close to the USG building, or you're not working in the USG building, you have to drive. Parking in the building, we will validate your parking for 2.5 hours. So that's great that you don't have to worry about parking. This slide is also showing that it's free for you to join and use the fitness center, but if you want to take part in any of our group fitness classes, or if you want to use one of the staff members for personal training sessions, those come with an additional fee, and the rates are there for you. We let you also come in and try classes. Our lunchtime classes right now from 11:45 to 12:30. There is an abs class on Thursdays, so it's 11:45 to 12:15. So that's our only 30-minute class. The other ones are 45 minutes. The rates are there, but we allow you to come in and try out a class before you spend any money. So if you want to interested in any of the classes, come in, tell us which one you want to try out, we'll let you do that. Then after that, you can decide if you want to continue with one of our packages that we have listed there. And those are some pretty good rates. Once you buy those packages, you are free to use those with any of the classes you want. You don't have to take that same format. We also have a cycling class. We have a body toning class. I already mentioned the hardcore abs class. We have a stretching class on Fridays. You can apply those packages to any of those classes. You don't have to stick with one particular format. And then going into the personal training sessions, that is up to you which trainer you want to use that's there on staff. There's 4 of us on staff there, so you could come in and try one of us out or all of us out. You know, we give you a fitness assessment, which will include going over your body weight, your body fat, going over the goals that you have. And then from there, you know, your trainer will customize a workout for you based upon your fitness goals. The slide also shows that we, again, those hours there, fitness center hours are 5 a.m. to 8 p.m. Monday through Friday, and unfortunately we are closed on weekends. We always get that question. If we're open on weekends, we're not open on weekends. We're closed Saturdays and Sundays. But the information to contact us is right there. You see the number. You can call 213-418-3261, or you can email us at onefitness@metro.net. Next slide. These are just some images of the fitness center. You can see the first one is an image of our front desk where you grab your towels and where the staff will be sometimes when you check in, answer any questions. Sometimes we're out on the floor assisting members, but that is kind of our centralized location. So if you want to talk with us or anybody when you come into the fitness center, you'll find one of us behind the desk or somewhere close in the vicinity within the fitness center. There's our general cardio area. We have a few treadmills. We have some stair climbers. We have a stairmaster. We have some stationary bikes. And then we go over to our free weight area over there. Not pictured is a full set of dumbbells that goes all the way from 5 pounds to 80 pounds. Sorry, 5 pounds to 85 pounds, full set of dumbbells. And you can see the free weights there, which you can use that squat rack for squats. You can use it for deadlifts. You can use it for bench press. There's also a leg press machine there as well. We have a full line of life fitness equipment that works you out from head to toe, starting out with the upper body and going all the way down to the legs. We have 2 small stretching areas. And our classes are done inside a fitness studio, which is also not pictured there. The fitness studio is where we will conduct our classes. Doors closed and it's closed off from the rest of the fitness center. So while those classes are going on, they don't interfere with folks that are just there for the general workouts. And that is how our fitness center looks. Next slide, please. And that is me, Myron McLeod, your fitness director. I'm one of 4 staff members that are always on site there again to assist you with anything you need while you're there at spending your time with us at the fitness center. De-stressing, keeping yourselves in shape. And again, please come down and see us.
Thank you for participating in this presentation. We'd appreciate your feedback. Using your smartphone camera, scan the QR code and follow the link to our evaluation. Submit your name, badge, and evaluation to be entered into a raffle. Here are the rules. 1 evaluation/raffle entry per employee per presentation. Winners will be selected at the upcoming information sessions.
Good day, everyone. My name is Sebastian Spencer, and I'm the Business Development Representative for Northrop Grumman Federal Credit Union. And we just want to talk to you about a few things that we do at our credit union. As you can see, the main thing that we do is delivering value to our members. So we'll go to the next slide. And like I said, my name, Sebastian Spencer. That's my information down there if you want to get in contact with me about anything that we discussed today. Now, a few things about the credit union on the next slide. As you can see, because we're a credit union, the number one thing about us is that we are not for profit. You know, a lot of the big bank corporations, they are for profit. That's not us. We have a high member base and we consider our members to be owners. And that's one of the reasons why when you open an account with us, they don't just call it a savings account. We call it a regular share account. Okay, so that's basically just to show that we look at our members as shareholders. Okay, and you see a lot of the people that are on the board of trustees for a lot of big banks and big banks and corporations, they get paid. Okay, a lot of the people that are volunteers for our board of trustees, they do not get paid. These are people that strictly want to do this job. As you can see, the NCUA, the National Credit Union Administration, that is who we are protected by and ensures that our members' funds are safe. With us, you get higher savings, lower loan rates, fewer and lower fees. And that's one of the best things that our credit union has to offer, is that you always are getting a better rate. And we want to make sure that our members are getting the best for their value. Okay. And like I just talked about, the average consumer banks, number one thing we talk about is them being for profit. Private investors and stockholders maximize their profit on your money. Okay. So you're getting, they're getting paid. The FDIC is a little bit different. Funds are still insured, but it's a lot different. But you do get higher loan rates, more fees, and lower savings rates. So you're doing much better when you bank with a credit union, specifically Northrop Grumman Federal Credit Union, because we do offer some of the most competitive rates. For the benefits, okay, we don't have any fees for our checking accounts, and you get debit account rewards. So there's a win-win situation right there. You don't get any fees with your checking account, and you get rewards for using your debit card, which is a great thing because everyone uses their debit card. Concierge home loan service. We have a mortgage team that works diligently to make sure that you get the information that you need and are making sure that you're in a position to where you feel comfortable about your home buying process. Auto buying services, the same thing as well. When you go into one of our credit unions and you deal with one of our loan operations rep, or you deal with the member service rep, they make sure that you have the best rate, and you have all the information that you need to know going into buying a car. Exceptional member service, you get that all the way across the board with us. New member incentives as well. We have a lot of incentives for new members. If you join our credit union and you are a Metro employee, you get $50. And we do this thing, we call it's a 50-60-50. So you get $50 automatically upon opening the account. You get $60 when you use that debit card. 60 times $5 or more in that 90-day period, you'll get credited the $60 on your account. And the reason why we do that is because we want you to experience the bank, use the card, make sure that you're getting a glimpse of how everything works with the credit union, and take that debit card for a spin. That's why we want to give you the $60 for it. And then finally, the $50 that we give you. Okay, so the 50-60-50, the $50 that we give you finally, that's for if you borrow with us. So if you get any type of loan or credit product with us, the credit union will give you an extra $50 as well. And that, to me, is a good offer. Who wants to turn down a free $160? So that's another thing that we like to do, is have incentives to let members know that we do care, and we want to show you how much of a difference it is between us and a big bank corporation. And of course, we talked about the low loans with the big perks. Okay, for specific loans that we do have here, you get a quarter of a discount if you decide to do auto pay. Okay, and that's something that a lot of people would like to take advantage of. The quarter of the discount can sometimes make a difference in just a little bit of the tax, or saving that extra $15 or $20. So sometimes it is worth it. Now, one of the things that we're big on is support and collaboration. As you can see, some of the pictures here are from Metro's Bring Your Kid to Work Day. And we take extreme pride in making sure that we market to everyone. So not just the members that come here and open accounts too, we want them to know that we are there for the youth as well. And we are very big on youth accounts. As you can see, we enjoyed having this great day with the kids. They came in the credit union, and it's always good for them just to see how banking works early on. So that's one of the things that we implement with our credit union. see more pictures from the event. And that's one of our big mainstays. You can see in that second row, the second picture, Stash McCash. That's our mascot that we like to use for our youth accounts, and it's been working wonders for us. The kids love the squirrel, and that's the number one thing. We want to make sure, as you can see, you can't really see on there, but it says I have $25 for youth. So for the youth accounts, what we do is we match up to $25. So if you put 25 in the account, so will we. And that's just a way of getting the accounts for the youth started. Once the kids are 13, they can get a checking account as well, and a savings and a debit card. So they can get a package all together once they're 13. And that's just the number one thing that we want to do. We just want to create a financial literacy for kids and for them to see how everything works in the banking world early on. This is one of my favorite things about our credit union right here, the financial wellness webinars. If there's anything that you want to learn about, we will teach it to you. Okay. Uh, this is what a lot of people ask about, stuff like this. When I go to new hire orientations, they want to know about bill consolidations, credit counseling. How can I get my credit score up, or how can I make my credit score work for me to do certain things that I need to do? What I just talked about, the youth accounts as well. HELOC, if you're somebody that's been owning your home for a few years and you're looking to do some remodeling, you've been wanting to fix that den, switch up that bathroom or get that nice kitchen that you've been looking for, they can teach you about these things in the webinar about how to get a HELOC and help you accomplish your goals. Banking with us, you do get a few perks, more than a few perks, but this is one of my favorites, because who doesn't like to get paid, and who doesn't like to get paid even earlier? Okay. So our direct deposit starts sometimes 2 days early for most people. I've seen a lot of the Metro employees get paid on Wednesday around 2, maybe in the afternoon, sometimes earlier than that. So that's one of the biggest things with us. The call center service is very, very complete. We have a really good call center service team. And mobile banking is one of the biggest things. I know a lot of people don't go inside of banks or credit unions for that matter anymore. So mobile banking is very, very big with us. You can make deposits, okay? You can do transfers, you can set up automatic payments. These are all things that you can do with our mobile banking system and online banking system as well. Now, for the co-op shared branching, this is one of the biggest features of our credit union. We have 3 main locations, which is one in downtown LA, okay, here at Gateway Plaza, one in Gardena, and we have another location in Palmdale. I always let people know about the co-op shared branching system, because so many people say, well, you guys don't have one close to me. And this is the number one thing that I show them: 30,000 fee-free nationwide ATMs. And, this is a newer presentation that is updated, but the last presentation that we used to show, it had a number of ATMs from each big bank corporation. And I believe it was 15,000 for other banks. Okay. So with 30,000 fee-free nationwide ATMs, you are much more likely to find an ATM that does not charge you than you would for some ATM that would. So this is the number one thing. And the co-op shared branching system is just a family of credit unions that work together so that other credit unions can do business. Okay. So if you go to a fee-free ATM, a co-op ATM, you won't get charged there. You might not have the same capabilities that you would at a Northrop Grumman ATM, but you'll still be able to withdraw money. You should still be able to deposit money at some of them. Okay, so not all of them, like I said, have the same capabilities. And then we talk about the share branch access. Okay, so if you're somebody that needs to get a check all the time and you're not close to a Northrop Grumman Federal Credit Union, this is going to work wonders for you. A share branch credit union that is right next to you, you'll be able to go inside and transact, do business as usual. The only thing you won't be able to do is anything where you have to change something on your account, or you're looking to do some type of business with loans or anything like that, you'd have to come and talk with us specifically, whether it be online, over the phone, or in person. But the 5,000 access to share branches worldwide is actually one of the best offers that you can have with us. And this is just a map that shows all of the places where you can have access. Okay, we have 26 offices and branches and 51 ATMs at or near Northrop Grumman locations in 12 states with site engagement, or even more states. Okay, so I like to show this map all the time because you see, of course, we're right here in California, and there's a ton of ATMs and share branches there. Okay, more than anywhere. But you still see places with ATMs with the green. Okay, so they're all over, and you'll always have access. You will always have access, and that's my number one thing that I like to stress to our members or potential members, is that you don't have to worry about not having access to your money. You look around anywhere, you'll be able to find access to a Northrop Grumman ATM or share branch ATM. Now, security features, okay? Account password, secured member info. If you know anything about Northrop Grumman Federal Credit Union, they are serious about security features. You know, uh, sometimes our card services team are loaded with security calls, just because they are always monitoring uh, accounts, debit cards, credit cards, because they want to make sure that it's you that's using your card. And I think this is a very good thing, very good thing. And you get alerts as well. You can set it up on your own. If you're somebody that likes to know how much you're spending, know when your card is being used, we have alerts for that. Okay. And then you see where it says web page tips to prevent fraud. Number one thing that we do is make sure that our members are safe online, okay? Because they're during this time where holiday is going on and a lot of online shopping is going on, there's a lot of online fraud. So what we do is they have webinars for that too as well, to how to protect your account, how to protect your assets and your money and everything. So that's one of the main things. Digital wallet, we have access to those too. Card control is another thing that we talked about when it comes to knowing when your card is being used and how much is being used. You can set up all type of alerts for that. Now, welcome to the Northrop Grumman family. And this is exactly what I talked about earlier. Okay. And who doesn't want to get paid? All right. You know, join and get paid $50. Like I said earlier, swipe and get paid. You swipe the card up to 60 times, $5 minimum in that 90-day period. And as much as everyone uses their debit card, you're going to definitely use it that many times in that amount of time in 90 days. You might rack up 60 transactions within 30 days alone. So this is a good deal to me. I mean, you get to see how the credit union debit card works. You get to see how it functions, and you get paid for it. Number one. And then we go to the last one, borrow and get paid. And as you can see right there, the picture of the people in the car. And let's just say you're looking to get an auto loan. And let's say you already have a car. You're looking to get refinanced. Let's get you to a lower rate and a lower payment possibly, and you get paid for that. So that is one of the things that I love. We are paying people to have great experiences with us. Okay. More money, more money. And this is one of my favorite ones as well. All you have to do is spread the word. That's it. It pays to share. So whenever you refer a new person to Northrop Grumman Federal Credit Union, you get $75. And you can do that for up to 10 people. So $750 to tell your aunt, cousin, sister, brother, whoever you want. And that's going to do it for me today. I hope you took something from this presentation. I hope you saw something that you liked or something that will make you inquire with us. Please give me a call. Once again, my name is Sebastian Spencer, and I am the business development rep, and we would love to have your business and your service.
Thank you for participating in this presentation. We'd appreciate your feedback. Using your smartphone camera, scan the QR code and follow the link to our evaluation. Submit your name, badge, and evaluation to be entered into a raffle. Here are the rules. One evaluation/raffle entry per employee per presentation. Winners will be selected at the upcoming information sessions.
Thank you. Welcome, everyone. My name is Jessica Cicada. I'm your retirement plan specialist with Mission Square. Today's topic, we're going to focus on 10 key questions you should ask to help prepare for retirement, transition into it, and navigate it. Question number 1. What will you do? Next slide, please. I want you to envision yourself, take a couple of seconds, envision yourself in retirement. Next slide, please. What does that mean to you? What will it look like? Are you going to be spending more time with family? Are you going to start a brand new hobby, maybe travel a little bit or volunteer or work part-time? Whatever it might be, there's no single definition. It's going to be your retirement. Next slide, please. Okay, a couple resources here for you. For volunteering, you can go to www.volunteermatch.org. For goals and priorities, you can go to lifeimagine.org through AARP. Next slide, please. All right, question number 2. When will you retire? But before you answer that, next slide, please. I want you to think about the benefits of working longer. Besides the financial benefits, research has shown that if you work a little bit longer, this can boost your health, mental sharpness, and of course, continue to create social bonds with colleagues. Next slide, please. But I don't want you to assume that you're going to work X amount of time or that you're going to work for X amount of time as well or retire a little bit later. As you can see here, 1 in 2 participants stop working earlier than anticipated. 60% has to do with health and disability, 27% could be changes to employer, and 22% become caregivers. Next slide, please. All right, the next question is, where will you live? But before that, I also want to mention that this is one of the things when Crystal and I talk about save as much as you can whenever you can. It's basically that you want to save when the time comes when you can no longer work. All right, so moving on to question number 3, where will you live? Next slide, please. All right, besides climate, maybe you want to go ahead and retire closer to family members, or maybe have more proximity to healthcare, or the cost of living might be a little bit easier on your budget. Whatever it is, we're here for you. Next slide, please. Here are a couple more resources that you can go to: taxfoundation.org, retirementliving.com/taxes by state for location, successfulaging.org. Next slide, please. All right, question number 4. This is where we start with the money questions. How much will you spend? Next question. For the rule of thumb, basically what we want is to get you to 80% of your retirement income. This pretty much tells us that you can maintain your lifestyle with this 80%. People will need a little bit more, some people will need a little bit less. Next slide, please. The key thing is knowing how much you want to spend, what are your needs and wants, not just for now, but also in retirement, knowing that this can change in the future, but at least you'll have an idea. Next slide, please. And of course, because life throws curveballs at us, we want to make sure we leave room for uncertainty. Maybe we have longevity in our family, or inflation's up, taxes are up. Health and long-term care problems occur as we get older as well. So we want to plan for that. Next slide. Couple more resources here for you. Next slide. All right. Question number 5. Where will the money come from? Next slide. For most of us in the pension industry, in the public sector, the pension is going to be the resource your first resource when it comes to retirement. So a couple things you want to know is, what age do you plan on retirement? When do when will your pension start? How much will you get? Is it going to adjust for the cost of living? And what are the surviving choices for your spouse? Next question. Another factor to take into consideration is Social Security. Just like your pension, knowing when to start makes a big difference. So in here, you can see that if you start Social Security at age 62, you get about 70% of your retirement benefit. But if you wait until age 70, for every year that you wait to collect Social Security beyond age 67, you get 8% more. So this might be a benefit that you might want to consider. Go ahead and access your Social Security online, or you can talk to one of our financial professionals. Our certified financial planners are here to assist you with that as well. And for those that may not have Social Security or are not covered through Social Security, and you're thinking about the windfall effect, just to let you know, right now it's currently at $500 less your benefit. Let's move on. Next slide, please. Okay, so once we have these calculations and we know our expenses and what our resources are, let's put it all together. So we have calculators to help you assist in doing your projections. We have advice services, and certainly we can let you know whether or not it's time for a financial plan. Next slide, please. If it turns out that you don't have enough savings, we can catch it early. We want to make sure that we either save a little bit more, spend a little less. We might think about delaying our retirement. You might want to earn income during retirement, or maybe consider downsizing your home. The goal here is to control what you can while you can. Next slide, please. All right, so what are the savings that are available for you? 2023 limits for the 401k and 457 are $22,500 for the year. If you're over the age of 50, you can contribute an additional $6,500 for a total of $30,000. If you are ready to retire and you're within 3 years of retirement, and you might be able to do a pre-retirement catch-up, that can be an additional $22,500 along with the general limit for a total of $45,000. Next slide, please. The limits for the IRAs are $6,500. If you're over the age of 50, you can do an additional $1,000 for a total of $7,500. I want to go ahead and also let you know what the limits are for 2024. They are going up by $500, the normal distribution limit. So the 401k, the 457, the limit will now be $23,000. For the IRAs, it will be $7,000. The limits for the catch-ups or the pre-retirement catch-up do not change. Next slide, please. Okay, now you're getting ready to retire. How will you turn your savings into retirement? Next slide. All right, so remember when we talked about those essential expenses and that the majority of your money might come from your pension and Social Security? In order to close that gap that most of us most likely will have, maybe you might want to consider adding an annuity. Okay, this will help ensure that no matter how long you live or what the market conditions are, that you'll never outlive your money. But they are expensive. Next slide, please. For those of you that want to have a little bit more control of your assets, you may want to consider dividing your investments based on when you need your money. For the most part, if you need your money the next 3 to 5 years, you want to go ahead and have lower risk, or maybe even not be in the market. For those that have 10, 15 years or more before touching your money, you can still consider taking a little bit of risk. This will help against inflation. You'll hear me say this throughout the presentation. Next slide, please. The name of this game is called flexibility. So when you're retired, you can also have the strategy of, if 1 year your investments are not performing, you can go ahead and take out less money in year 2. And then when year 3 comes around, you can go back to your original distributions. This is where we take the uncertainties into consideration and we plan for this. Next slide, please. Okay, how will you invest your savings? There's no question that when you're in the market, there's always going to be risk as well as the rewards. Next slide. So what happens when we decide to retire and the market is down? Our first thought would probably be, let's get out of the market. I'm retired already. But keep in mind that if you do that, you are locking in the losses, and chances are that you will run out of money by not being in the market or being able to recover can be huge. Next slide, please. So what do? It's going to be a balancing act. Again, we want to make sure that we're not taking as much risk with the money that we plan on using in the short term, but also the money that we don't need in the long term, we're protecting it against inflation. And again, just want to let you know that if you're not involved in the market, this can drastically increase your chances of running out of money. Inflation's no joke. So next slide, please. Couple things that we can do to help manage the risk is do a rebalancing of our portfolios. Basically, what rebalancing helps us do is we take the risk, we take the outperforming stock and we sell it and move it to the bonds that are not performing or any investments that are not performing. So if we see the situation here, if you look here, starting in year one, you have 30% bonds, 70% stock. By the end of year one, the bond market is now 20% and your stocks are 80%. When we rebalance, we're taking 10% of the earnings from the stock and we're buying 10% of the bonds so that when year two starts, you're back at your original risk of 30% bonds, 70% stock. Next slide, please. Okay, question number 8, how will you manage your taxes? Taxes are everywhere. Next slide, please. Just as a reminder, we pay taxes in tiers, as you can see here. Next slide. Diversifying your taxes. This is one of the strategies that we like to use. It's always a good idea to have different tax assets. Your 401k, 457 are considered pre-tax and you pay ordinary taxes. If you are at a point where you're going to be going into the next tax bracket or the next tier, you may want to consider taking money out of the Roth IRA in order to avoid going into that next tier tax bracket. Or use non-retirement taxes or capital gain taxes. So remember, capital gain taxes, as of currently, they're at 15% if you hold investments for 1 year. Any investments that are sold before the 1 year are considered ordinary or are taxed at ordinary income. Next slide, please. Okay, how will you plan your estate? Next slide. So estate planning is for everybody, and it's not just about reducing your estate taxes. We want to make sure that you have control of your assets and you protect your assets in case you become disabled. You want to ensure that your assets go to whom you want and when after you're gone. Also, you want to clearly communicate all your wishes in order to avoid family problems. So, next slide. Key estate plan documents to consider: beneficiary designation, wills, financial power of attorney, durable and medical power of attorney, and living trust, living will and living trust. Next slide, please. Resources for you. Basically, we ask that you consult an estate planning professional, not your family criminal lawyer or family law planning. We want to have somebody that specializes in estate planning. Next slide, please. All right, we're down to the last question. Who will guide you through all of this? Next slide. All these topics and goals, they are all interrelated with each other. So what you do with one will drastically affect the other. Well, we're here for you. Next slide. You want to go ahead and talk to a financial professional so that we can help you set goals, weigh all your options, set and follow systems in order to keep you in track, and manage your emotions throughout challenging life times. Next slide, please. So we encourage you to get a financial plan. Mission Square certified financial planners are available to you for a low or free. We can also encourage you to talk to Crystal and I. We can help you point you in the right direction. Next slide. Okay, this concludes our presentation. Thank you all for sticking around. And I cannot wait to talk to each and every one of you and make sure we get started on your retirement planning. Have a good day.
Thank you for participating in this presentation. We'd appreciate your feedback. Using your smartphone camera, scan the QR code and follow the link to our evaluation. Submit your name, badge, and evaluation to be entered into a raffle. Here are the rules. 1 evaluation/raffle entry per employee per presentation. Winners will be selected at the upcoming information sessions.
Thank you all for joining this session to go over the value-added tools and resources available with your membership with Anthem. Next slide, thanks. The first thing I want to talk about is our Anthem Blue Cross mobile app, which is called Sydney Health mobile app. You see the little logo on the screen, the 2 little text boxes. You're going to look for that in your app store to download it. And you're going to use your same login profile that you would use on anthem.com to get to your personal profile to log into your profile through Sydney Health. And almost everything that's available on our website is now available through Sydney Health and even more. I really love the mobile app because my favorite thing is the fact that I can view my ID card on my smartphone. I can fax it and email it to my doctor from my phone, and I don't have to carry around a hard copy of my ID card anymore. I'll have full access to it. I can also look up doctors. I can even compare procedures at different facilities. I can see all my benefits, look at my claims, submit claims. I can manage my mail order pharmacy prescriptions and see how my other prescriptions have run. You can access different wellness resources, a fitness tracker. You can reach member services. So you can have a text chat with member services, or you can call them, or you can also request a call back from member services at a scheduled time that works for you. And my other favorite feature that's available through our Sydney Health mobile app is virtual care. So virtual care you can use in lieu of urgent care. So if it's the middle of the night and you're sick or your child's sick, and you can have that doctor's visit from your smartphone or from your tablet or laptop, any of those those ways. And you can have that doctor's visit in the middle of the night without having to leave your home, without having to put on shoes. And they can even prescribe medications as well, as long as they're not controlled substances. It's also in network for virtual care for mental health. So you can see a psychiatrist, psychologist, or therapist, and you can get in a lot quicker than you could normally with a brick and mortar facility. Usually you can see a provider within 4 days. The last time I checked, there was same day appointments, next day appointments. They have evening and weekend appointments as well. So it's a really great way to access that care that you need and provide some flexibility, because you can do it for your schedule and no matter where you are, even if you're traveling. Okay, next slide. So we talked about the virtual care, kind of skipped ahead here, but just know that urgent care visits are available 24/7. And then the mental health visits are available 7 days a week with a wide range of hours, but it's not 24/7. And you can log in to use virtual care through Sydney Health. A tip I have on here is, for my normal pharmacy, I don't use a 24-hour pharmacy, but when I log my pharmacy for virtual care, I put a 24-hour pharmacy on there. So if I use virtual care in the middle of the night, the 24-hour pharmacy is the one that they would automatically send my medications to, so I could have someone pick it up for me in the middle of the night if I needed. Okay, next slide. If you haven't seen this already, on the back of your ID card is a phone number for a 24/7 nurse line. So you can call registered nurse 24/7 and ask different health questions. Maybe you want to ask if you should go to urgent care or go to the emergency room or wait to make an appointment with your primary care doctor. You could speak to a registered nurse on that. Maybe depending on what symptoms you have, you could ask what over-the-counter medications you should be taking based on your symptoms. It's always a great place to start, and there's no cost for using this service. Next slide. Condition care. So we have programs for people that have certain conditions that will help manage your conditions. And so it's a dedicated nurse team depending on those conditions. So it's for asthma, diabetes, heart disease or heart failure, and COPD. If you happen to have any claims related to these conditions, you may receive an outreach phone call from Anthem Blue Cross asking you if you're interested in one of these conditions. And the nurse case managers will make sure that you're getting the care that you need, that you're seeing your specialist, that you're able to get your referrals and authorizations in place, and also to make sure that you're getting all of your medications that you need. And so if you're unsure if the call that you're getting from Anthem Blue Cross is a scam or not, you can always call member services back and ask them if you were scheduled to receive an outreach phone call from Anthem, and they can confirm that or not. And then you can reach out to that program and get yourself enrolled. Next slide. Another program that we have is our diabetes prevention program. This program is for people that are not diabetic, but have risk factors for diabetes, which is many of us. So to find out if you qualify for this program, you're going to go to the Sydney Health mobile app, and under My Health Dashboard, you're going to be searching for the LARC diabetes program, and you're going to take a quick survey. At the end of this very short survey, they'll let you know whether you qualify, meaning you have enough risk factors for diabetes, or if you don't qualify. If you qualify, they're going to have you download the LARC app, and they're going to send you out a free digital scale. And along with the LARC app, where they're going to give you some health coaching to make the best decisions for your food and to move your body and all of those types of things. And then you're going to use the scale, and the scale is going to automatically send your weight over to the LARC app to keep track of that. And then once you're using the program for about 5 weeks, you'll receive an email with a voucher to redeem it for a free Fitbit. And then you can start logging your exercise and your steps using that Fitbit with the LARC app. And so you can use this LARC app for up to 12 months if you're using the program to really help you with your lifestyle management, to help you lose some weight, and to help you reduce your chances of becoming a type 2 diabetic. All right, next slide. Another program that we have is Building Healthy Families. If you're familiar with our Future Moms program, it's similar to that, but we've upgraded to Building Healthy Families because not all families are built through moms. And so this is going to give you resources for if you're pregnant, infertility, if you are adopting, if you're using a surrogate. They're going to give you all those resources for that part of it, and also while raising young children. So resources for babies and toddlers and little kids, because it's such a change in life, we want to provide you with these resources. You can find the Building Healthy Families program through our Sydney Health mobile app starting January 1st. And then you can go on there and see what digital content are available and different people that you can reach out to. Lots of tools and resources available through them. Okay, next app, or next slide. For those of you and your dependents that are going through cancer, we know how difficult it is. Not only physically difficult, but also there's so many different authorizations that are needed and care that's needed and approvals for different things, and also the emotional toll that this takes. So we have our Cancer Care Navigator program for people that are going through a cancer journey. They're going to provide you with a dedicated contact for you to reach out to talk about what your needs are because of your cancer diagnosis and your care plan. Maybe you go to the doctor and you didn't understand what the doctor said. Maybe something was difficult to understand. They're going to be able to help explain what's going on, reach out to your doctor if needed, get you in to get the authorizations that are needed to make sure that your care goes as smoothly as possible. If this is a program that you need, you can definitely find the access to this through member services. Okay, next slide. We have many behavioral health resources. I've kind of already talked about the virtual care one. You can also go to see providers brick and mortar. So you can use the Sydney Health mobile app to look up where providers are that are close to your home or to your work. And then a new option that we have, this is providers that are in network called Path. But what Path does is it contracts with providers, pulls them under the house. You go to Path, to the website pathmentalhealth.com. And then you can search the providers and by criteria. So let's say you want a female that speaks Spanish, that understands cognitive behavioral therapy, and has expertise in codependency. You can kind of build that criteria, and then it will give you a list of those doctors that meet your criteria. And it will also show you when they have appointments available. And then once you pick the doctor that you want to see, and you can say what appointment time you want, Path actually schedules the appointment for you. So it removes a lot of the barriers to care. You're not having to call different providers, see if they're available. You can more easily find a provider available to you, and their visits are virtual. So you can attend these visits from wherever you are. There's also a phone number on the screen too, if you want to talk to Path and walk through their system and how to find a provider that best meets your needs. Next slide. One of the features on your portal on anthem.com is special offers. This is a discount program that we provide. We partner with different vendors to provide these discounts. These discounts, we're always adding new ones on there. So some examples would be 1-800-CONTACTS, glasses.com, Global Fit, which is gym membership discounts, Active and Fit Directed, that is also gym membership discounts, pet insurance discounts, vitamin discounts, and so much more. I highly recommend that you check it out. So when you go to your personal profile on anthem.com, you're going to click on care, and under care, there's a drop-down menu, and you click on discounts, and that's where you're going to find all of these available to you. Okay, next slide. Contacting member services. There's a few different ways to do this. You can call Anthem member services on your the phone numbers on the back of your ID card. You can log into your personal portal on anthem.com and request a call back from member services at a scheduled time that works for you. You can even chat with member services or send an email to member services all through your personal portal on Sydney Health or on anthem.com. Next slide. Thank you so much for attending this informational system program about our tools and resources. Have a wonderful day.
Thank you for participating in this presentation. We'd appreciate your feedback. Using your smartphone camera, scan the QR code and follow the link to our evaluation. Submit your name, badge, and evaluation to be entered into a raffle. Here are the rules. 1 evaluation/raffle entry per employee per presentation. Winners will be selected at the upcoming information sessions.
Okay, thank you. Hi, good afternoon. My name is Windsor Richmond. I am the sales manager for Anthem Blue Cross. My section, I would like to talk to those of you who are contemplating or deciding about retiring soon. So we're going to do quickly a Medicare 101 Beginner's Guide to Medicare. Next slide, please. What we're going to cover are some of the basics. I'm going to let you know what you need to do about signing up and moving from your current plan into your Medicare. Next slide, please. So let's go over the basics of Medicare, getting to know Medicare. Next slide. First thing first. First, let's go over Part A, hospital insurance. You're going to learn about the Part A. We'll go over the individual slides in a few minutes. Part A insurance, which is your hospital. Part B insurance is your medical. Medicare supplement is what is commonly known as a Medigap, very similar to with what you may be used to with a PPO. Part D is your prescription drug plan that you will maybe add on to your Medicare supplement plan. And Part C is pretty much a Medicare Advantage HMO plan for you. Next slide. So to give you a little bit more in detail, Medicare is pretty much has two types. When you receive your Medicare, it's a red, white, and blue card, and it's going to show your Part A. This is the hospital insurance covers your hospital stays, skilled nursing facility care, hospice, and any at-home care that is prescribed from your doctor. You will then also have another part, which is your Part B. This is medical insurance. This one will cover anything that is pretty much on an out basis. So you have your physician visits, your lab tests, surgeries, preventive health appointments, outpatient services, or durable medical equipment. And this is where parts of your basic coverage of Medicare. Next slide. Now, with original Medicare, as I mentioned, is both parts A and B. You may not have all of the coverage that you need. Medicare is an old-fashioned insurance where we pretty much do not even have this type of insurance around anymore because it has a lot of deductibles and co-insurance. So the good news is that you have other options to work with your Medicare. So when you are looking at this, your Medicare supplement plans can help you pay out of pocket. Your Part D is what you will have with your Medicare supplement plan that will cover all of your prescriptions. I won't say all of it, but of course, formularies, we're used to that word already. But once you get on Medicare, you will also have a formulary list. Part C, this is your Medicare Advantage plan where everything is bundled together for your medical, your hospital, pharmacy, and a lot of extras that come with that plan. Next slide. Now, to give you a little bit more detail, as I mentioned earlier, Medicare supplement plan is known as a Medigap insurance, but a lot of people understand it a little bit more because it does work very similar to a PPO. So once you want to keep this in mind because it isn't a PPO, but it works similar to a PPO. This plan will help you cover deductibles, co-pays, and co-insurance, even when you're traveling out of the state of California. You'll also be able to choose from any doctor that accepts Medicare. It does not include the prescription plan, so you will have a premium for your Medicare supplement as well as a premium for your Part D. My advice to most people, if you want a Medicare supplement, if that's something that you're looking into, then you are saying to yourself that I would like to go to doctors when I want, how I want, and then it's just a little bit more flexibility for yourself. However, it's probably the one that is the most costly. Okay, thank you. Next slide. Now, Part D prescription plans. This is where you will need to reach out and purchase an individual Part D plan. With here at Anthem, we do offer 2 Part D plans. With this plan, you would want to look at the formulary to see which plan will best fit your needs and to cover most of your prescriptions. And then also, you may also qualify for prescription drug assistance, which is through the federal program called Extra Help. Next slide. Now, our Medicare Advantage plans, I forgot to mention on the Medicare supplements, we do have different options for you on the Medicare supplement plans. There's 3 different options. Now, on the Medicare Advantage plans, there also are different options that you can get, and this is a Medicare HMO type plan. And this one will replace your original Medicare A and B, and you get coverage through a network of providers for your hospital and your pharmacy expenses. Now, with this one, your cost is 0 or low no monthly premium. You do not have any deductibles, and it does have a set out-of-pocket maximums. In other words, you do have a set dollar amount that you're going to pay out of pocket. On the Medicare Advantage plans, you do receive dental coverage. You have a vision for your eyeglasses. You get hearing aid coverage, and then your prescription drug plans are also included with this. And again, that is without a additional premium. And then we have other benefits such as transportation, access to your 24/7 nurse, just like what you have on your current commercial plan. You receive gym membership. You also receive spending allowance for over-the-counter items and healthy groceries and more. Next slide. So now the next question you may have, well, I have all these different options once I get on my Medicare. The most important thing is for you not to be on your Medicare by itself. Because if you're on your Medicare by itself, that is when your costs for your medical costs can really go up. So this is great that your employer wants to help prepare you for that next chapter in life, which is preparing for the Medicare. Now, which plan should you choose? You can consider first by the cost. Is it the premium, co-pays, deductibles, prescription drug prices, or the maximum out of pocket? If you go on a Advantage plan, you want to make sure that the doctors, the specialists, hospitals are all within that plan. Because remember, on a Medicare supplement, they just have to accept Medicare. What else do you need? Are you going to want to have the opportunity to have your vision, dental coverage, hearing care, gym memberships, allowances? So that's where you want to weigh the pros and cons on what's going to be the best for you with your Medicare. Next slide. Now, this slide here, it can help you also make a decision because it gives you a comparison of how the different plans work. As I mentioned, your original Medicare, that's with one check. So the remainder, you're responsible for the full cost under Medicare by itself. Now, when you get a Medicare supplement insurance plan, here at Anthem Blue Cross, we do offer these particular plans for you. And you may also be able to get the dental, vision, hearing, as well as the fitness benefit. So we actually should have two checks on there, but there are at an additional cost. We also have the prescription drug plans that you can get with your Medicare supplement. Then, of course, the Medicare Advantage plan, that one, there are no additional costs for that one on a monthly basis, and you're able to receive all those benefits on that particular one. Next slide. So now that I've gone through what helps you on understanding and getting your understanding and knowing what plans to work with your Medicare, how about signing up for Medicare? So once you let Metro know what you decide to do about your retirement, the first thing that you want to do is that you need to decide, when do I need to go talk to the Social Security office? So in this quick section, we're going to quickly go over what your Medicare eligibility means, working after 65, where to sign up and when to sign up, and when your coverage may start. Next slide. Yes. First, are you eligible for Medicare? One, you must be a permanent U.S. citizen, resident, or legal citizen living here in the U.S. 5 years in a row. Or two, you and your spouse must have worked and paid Social Security taxes for at least 10 years to qualify for your premium-free Part A, which, as I mentioned earlier, is your hospital coverage. And if you have not qualified for that at the time of your retirement, you may be able to purchase that at the Social Security office. Number three, you are at least 65 years old, or you may also qualify if you're under 65 with a form of disability. Next slide. Now, working after 65, some of you may be in this situation right now. If you have credible health insurance coverage through your employer, you do have options. You can wait to sign up for Medicare, or if your spouse has coverage, you can either work it that way. Now, one thing, if you're still working, it is pretty much best for you not to go see Social Security until you are aware of when you're going to retire. So there's a clause here. If your employer has fewer than 20 employees, then you would need to sign up. But with you here at Metro, you already know there's more than 20 of you here at your in your employer. So you definitely want to talk to your HR once you turn 65, because you really do not need to sign up for Medicare at this point. Next slide. Now, where do you sign up? Now, to help you understand why is Anthem Blue Cross telling me what I need to do in regards to this, we have a contract with Medicare, which is through the federal government. So you have two different entities. You have the Medicare for your red, white, and blue card, and then you have Social Security, which administers for your Social Security income. So to sign up for the first time for your Medicare, you would need to go to the Social Security office. You can either call them, or you can either go online to sign up for your Social Security. But it's always great. You can call them, schedule an appointment, but that is going to be your first step before you decide anything. Talk to your HR team, and then once you decide that you want to get on your Medicare, you will reach out to the Social Security office. And then after you reach out to the Social Security office, you can then reach out to us here at Anthem Blue Cross, and we can assist you in transitioning from your commercial plan to your individual plan. And your HR team does have all of our information, and we will be happy to assist you with anything that you may need after you turn 65. Next slide. So one of the most important things is that you do have a time slot. However, if you are still working at 65, your initial enrollment period can be when you turn 67. But the key is when you turn 65, as long as you have full health coverage, then you do not need to pursue with your Medicare insurance. But everybody's situation may be different. But if you have any additional questions, please do not hesitate to reach out to us. And as long as you're staying insured with your company, you will not receive a penalty. Next slide. Now, a Medicare supplement, the Medicare Advantage plans, you will speak to us after you receive your Medicare A and B. Next slide. And once you get your Medicare A and B, we will make sure that we do our best to get you started on the month that you become effective. The key is that you reach out to us before your effective date, and you can have your Medicare A and B, as well as what additional coverage you would like to have with your Medicare. And that is it. So I think moving from employer insurance to Medicare. Okay, that's what we're just talked about. We can go ahead with this. I'm sorry, next slide. Is that it? Yeah. Okay. So with your particular here at Metro, most of you when you retire, the key is for you to have to be qualified for your Medicare. But let's say that you are not eligible for the Medicare at that time. So you may then be on with the Cobra. So it will just vary with what specific type of insurance that you have once you retire. So let's skip to the Cobra portion of it. So a health savings account, health reimbursement, yes. So what to know about COBRA? So COBRA, as you know, is a temporary insurance to help fill in your insurance as you're trying to get your full. So if you are still working past 65 and you have your group insurance, you're going to be okay because at that point you will qualify for your Medicare. Now, under 65, this is when you may have to look into COBRA or you may have to go through the covered California. So that's where you will need to talk to your HR to decide what will be the best plan for you because COBRA is only for 18 months. And if you retire at 63 and you have 2 years till 65, that can leave you with 6 months of no coverage. So just plan wisely in regards to your health insurance. And then that's when working closely with your HR team will help get you to the next step. Well, thank you so much for taking the time and listening. And if you have any questions, as I mentioned, HR does have my information. Okay. Thank you.
Thank you for participating in this presentation. We'd appreciate your feedback. Using your smartphone camera, scan the QR code and follow the link to our evaluation. Submit your name, badge, and evaluation to be entered into a raffle. Here are the rules. 1 evaluation/raffle entry per employee per presentation. Winners will be selected at the upcoming information sessions.
Thank you. Hello and welcome. My name is Sylvia Gomez, and I'm your Kaiser Permanente representative. Joining me today is our Medicare consultant, Antonio Marquez, to present on Kaiser Permanente's Senior Advantage Plan. Today, I'll be highlighting our integrated quality care digital care options and membership perks. The information will help you select with confidence the right health plan for you and your family. Let's begin. Combined care and coverage means your Kaiser Permanente doctors, hospitals, and health plan benefits are connected. It's easier to get high quality care when and where you need it. From a team that knows your health, history, lifestyle, and preferences. You have more ways to get care by phone or video or in person at most of our facilities. You can see your doctor, get a lab test and or x-rays, and pick up prescriptions all without leaving the building. So you can save time by doing more in one visit. Whenever your health goals, we're with you every step of the way. There are many reasons to choose Kaiser Permanente. We provide quality care, convenience, access to care, as well as many membership perks to help you stay healthy. Up next, care that's personalized. Your personal doctor is your best health advocate. They coordinate your care with a multidisciplinary care team and make your health their top priority. Our doctors and caregivers reflect the diverse communities we serve and provide culturally responsive care in many different languages. Every contact with your care team is recorded on your electronic health records, which you and your doctor can access and review anytime and anywhere. This ensures that every caregiver you see has a full picture of your health without you having to repeat your story. Your care team also uses your electronic health record to help you schedule your checkups and tests. Up next, care that's convenient. When you need care, you can talk to a clinician in person, through email, over the phone, or by video. Visit us in person at a location near you, same day, next day, and weekend. Appointments are available at most locations. Schedule a phone or video visit with a doctor or clinician. Get 24/7 care advised by phone or online without an appointment. Get personalized care advice for certain conditions online, including some prescriptions and many lab tests. When you use telehealth services at Kaiser Permanente, you're connecting with the doctors who can see your health record and pick up where you left off. And most of our telehealth services are covered at no additional cost. Next is convenient care in person. If you prefer to visit us in person, it's easy to schedule an appointment at a location near you. No matter where you are, your Kaiser Permanente care team can see your medical history on your electronic health records. And because services are connected, many Kaiser Permanente facilities have pharmacies, labs, and other services all in the same building. So you can get more done in fewer stops. Next, convenient prescription refills. It's easy to refill prescriptions in person, over the phone, online, or at the Kaiser Permanente app. You can have most delivered to your home with same day or next day delivery, or order your prescriptions for same day pickup. Get a refill, reminders, or alerts. New prescriptions are available to order via text, mobile app notifications, or email. You can also place some orders by responding directly to our text message reminders. We'll provide status updates via text or email about shipping, delivery, or pickup information. Up next, convenient care while traveling. Your health and safety are our top priorities. So we make sure you're covered for urgent and emergency care anywhere in the world. And before you leave town, we can help you see if you need to get vaccinated, refill your prescription, and more. If you need to refill a prescription, you can get your medication refills at a local pharmacy. If you need emergency care, always use the emergency services where you are. Contact Kaiser Permanente when your connection is under control, when your condition, is under control, to make your care team aware of your condition and discuss your treatment. For detailed information on care while traveling, there's the Away from Home Travel line, available 24 hours a day, 7 days a week at 951-268-3900. kp.org/travel is a special section of kp.org that's focused on getting care while you're traveling. At Kaiser Permanente, we're committed to caring for all that is you, so you can achieve optimal health in mind, body, and spirit. Kaiser Permanente provides clinical and support services for a wide range of conditions, including anxiety, stress, depression, addiction, and autism spectrum disorders. Our mental health team also includes psychiatrists and psychologists, as well as marriage and family therapists, addiction medicine physicians, and medical social workers. And as a member, you do not need a referral for mental health care within Kaiser Permanente. To support members' emotional well-being, we provide many resources for self-care. Here is our self-care portfolio, starting with Calm. Uses meditation and mindfulness to help lower stress, reduce anxiety, and improve sleep quality. Available at no additional cost, the app offers something for everyone. A new 10-minute daily Calm meditation every day, guided meditations for anxiety, stress, gratitude, and more. Soothing bedtime tales for grown-ups, music for focus, relaxation, and sleep, Calm master classes taught by world-renowned experts and celebrities. Headspace Care app, You have access to on-demand emotional support coaching. The app's highly trained coaches are available 24/7 to provide personalized support. For coping with common challenges, use the app for 90 days a year at no additional cost. Text with the coach anytime, anywhere for one-on-one support. Discuss your goals, share challenges, and create action plans. Get interactive skill building tools. Track progress and work with your coach to adjust your action plan. My Strength app. Build a personalized plan to strengthen your emotional health whenever and wherever you need it. A personalized support plan, tools to manage stress, depression, sleep, and more. Hundreds of active and articles and videos. Up next, additional wellness resources. Here are some of the wellness resources to help you stay healthy. Get a special rates on a variety of products and services through the Choose Healthy program. These include specialty care services, acupuncture, chiropractic care, and massage therapy, and wellness offerings like gym memberships, home gym equipment, and wearable devices. Health classes. Choose from a large variety of classes and support groups offered in person and online. Classes vary by location and some may require a fee. Online wellness tools. Join a program to help you lose weight, reduce stress, quit smoking, and more at no additional cost to our members. Find helpful videos and articles, health calculators, podcasts, recipes, and more. Wellness coaching by phone. Get one-on-one guidance and support from a dedicated wellness coach who can help you get goals, stick to them, and most important, see the results. And you can do it all from the comfort of your home. Partnering with the wellness coach can help you manage your weight, reduce stress, quit tobacco, eat healthier, and increase activity. ClassPass, get reduced rates on in-person fitness classes, including Pilates, dance, and boxing. Up next, let's review the onboarding process for new KP members. Your health is a lifelong journey, and we want you to have the right doctor to go the distance. It's easy to browse through doctor profiles in your area and selected healthcare partners who feel comfortable with. As soon as you join, we want to make your care experience easier. With 10 days of your start date, you'll get a personalized welcome book in the mail, a welcome call from us, and your ID cards. And once you make it your first appointment, you'll get a pre-visit call. Start getting the care you need in 3 easy steps. Register at kp.org. Choose your new doctor. You can browse doctors by location and see details about their education, specialties, language spoken, and more online. Choose your doctor based on what's important to you and change anytime. Transition your care easily, move prescriptions so your treatment is uninterrupted, and find a care location that's close to your home or school. Get care on your schedule routine appointments, email non-urgent health questions to your Kaiser Permanente doctor's office, and check most lab results online. We understand that choosing a health plan is a big decision. You don't have to make it alone. If you have questions later on, you can get the answer you need to make informed decision. Call a Kaiser Permanente enrollment specialist Monday through Friday from 7 a.m. to 6 p.m. Pacific Standard Time. The number is 1-800-514-0985. Up next, let's learn about your plan benefits. Your plan option is the traditional HMO plan which is a zero deductible plan. Your services for primary care and specialty care and urgent care, it's $5 copay. There is no charge for preventative care like annual physicals, mammograms, and well-child preventive exams. A visit to the lab or radiology is at no charge. Your outpatient surgery is offered at $5 per procedure. This is when you're in and out the same day and don't require hospitalization. Hospitalization is at zero copay. Emergency care is offered at $50 copay per visit. However, it gets waived if you're admitted directly to the hospital. And lastly, prescriptions are $5 copay for generic up to 100-day supply and $10 copay for brand name medications up to 100-day supply. We offer a pharmacy mail order. We offer for this most generic brand name prescriptions, and shipping is offered at no cost. Keep in mind that you can also have a telephonic or virtual visit with your doctor, and virtual visits are covered at zero copay.
Thank you for participating in this presentation. We'd appreciate your feedback. Using your smartphone camera, scan the QR code and follow the link to our evaluation. Submit your name, badge, and evaluation to be entered into a raffle. Here are the rules. One evaluation/raffle entry per employee per presentation. Winners will be selected at the upcoming information sessions.
Good afternoon and welcome everyone. My name is Antonio Marquez. I am the Retiree Solutions Manager with Kaiser Permanente, and today I'm here to review the basics of Medicare. The goal of the presentation is to educate you on Medicare, its components, and to provide you with options and clarity when it comes to Medicare. The information I'll provide applies to anyone who's approaching the age of 65 or soon to get their Medicare. So let's go ahead and get started. So I'd like to begin with this slide to identify who is eligible for Medicare. And there's 5 parts here. The first one is individuals that are over the age of 65. The second one, individuals under the age of 65 who are deemed permanently disabled for Social Security, which requires a 2-year waiting period. Third, people of any age who have been diagnosed with end-stage renal disease, also known as ESRD or kidney failure. Fourth, a U.S. citizen or a permanent legal resident who has lived in the United States for at least 5 years. And lastly, individuals that are diagnosed with ALS also are eligible for Medicare. Just keep in mind that the most common way someone becomes Medicare eligible is when they reach the age of 65. So now that we've identified who is eligible for Medicare, I want to define what is Medicare. So Medicare is a federally funded health insurance program established back in 1965. Medicare was administered by the Centers for Medicare and Medicaid Services. So throughout my presentation, you'll hear me refer it as CMS for short. It was established to give individuals peace of mind, knowing they would have access to healthcare coverage. So on this slide, you can see that Medicare includes 4 parts. Part A, hospital insurance. Part B, medical insurance. Part D, prescription drug coverage. And Part C, Medicare Advantage, which is the program that Kaiser participates in. So to start off, I'll be reviewing Original Medicare, which is Parts A and B. Original Medicare has 2 basic components to it. The very first component is Medicare Part A, which is the biggest component of Medicare. Medicare Part A is hospital insurance, and it provides coverage for inpatient hospital care, skilled nursing facility care, hospice care, and some home health care needs. Medicare Part A is what we refer to as an earned benefit. What that means is that if you pay into Social Security for either 40 quarters or more, which is equal to 10 years of work, and not just 10 years with your employer, but 10 years in your lifetime. So as long as you pay Social Security for 10 years or more, you can receive Medicare Part A premium free. You can also qualify through your spouse as long as your spouse has earned that benefit. So if your spouse is at least 62 years of age and earned Part A and paid Medicare taxes, you can qualify through your spouse. Now, if you didn't earn it yourself or through your spouse, you still have the option to buy it. Most people do not pay a premium for Part A. So my recommendation is that if you're not sure if you qualify, please contact Social Security. Moving on. So now that we've broken down Part A, I want to talk a little bit about Part B. So Medicare Part B is also referred to as a medical insurance, which covers doctor's office visits and other healthcare provider services such as outpatient care, lab, radiology, durable medical equipment, dialysis, and some preventative care services. Just remember that Medicare Part A is an earned benefit. So as long as you've earned that benefit, it's premium free. Now, with Medicare Part B, B as in boy, it's a little different. Everyone is eligible for Part B because there's a premium associated with Part B. And that premium is based on your household income at retirement. Additionally, it's important for you to know that you must enroll in Medicare Part B once you become eligible, because if you don't, you can accrue a late enrollment penalty, which increases your Part B premium by 10% for every 12-month period you decline coverage. Now, there is an exception to the rule, and that's if you're still working past the age of 65 and covered by your employer plan. Or if you're covered, or if your spouse is still working and you're covered by his or her employer plan, at that point, you can postpone enrollment into Part B until you retire without accruing a late enrollment penalty. So this next slide provides a visual and a breakdown on how CMS sets premiums for your Part B. Premiums are assessed based on your household income. And what Medicare does, Medicare takes a 2-year look back at your retirement income to determine your Part B premium. So when you decide to retire, they'll be looking at your income for 2 years prior. So for example, if you retire in 2024, they'll be looking at your income in 2022. So on this chart, a single individual earning $103,000 or less, or a married couple earning $206,000 or less, will be paying the 2024 standard premium of $174.70. Below, you can see that the higher the income bracket, the higher the premium amount would be. Now, if you're ever in a situation where your income is a lot less this year, I do encourage you to contact Social Security and request for your account to be reviewed, request for an audit to determine your Part B premium based on your true retirement income. So now that we've gone over Original Medicare and the benefits they offer, let's go over how and when you can enroll in Original Medicare. And there's 3 different opportunities you can enroll. So I want to begin with the first opportunity, which is during the initial enrollment period, which starts 3 months before your 65th birthday, your birthday month, and 3 months after you turn 65, which is a 7-month period. Now, if you're already getting benefits from Social Security, you'll be automatically enrolled in both Part A and Part B starting the first day of the month you turn 65. Now, if you miss the initial enrollment period, you can also sign up during the general enrollment period, which begins every January 1st and ends March 31st of each year. Beginning January 1st of 2023, when you sign up during this period, your coverage starts the first day of the month you turn after you sign up. Now, if you do continue working past your 65th birthday, you can also enroll during the special enrollment period. And you have 8 months to enroll in Parts A and B after you retire. And move on to the next slide. So now that we've covered the different windows to enroll, I do want to transition to Medicare Part D, D as in David, which covers outpatient prescription drug coverage. There's 2 options to enroll in Medicare Part D. The first one is through an individual or employer group Medicare plan, Medicare Advantage plan, that includes Part D prescription drug coverage. An example is Kaiser Permanente's Senior Advantage plan that includes it. 2, a standalone prescription drug plan that offers prescription drug coverage only. Now, unlike with Parts A and B, You sign up for Part D directly with your plan. Plan Part D is not directly offered by Medicare or Social Security. Also, Medicare Part D, D as in David, has an income-related monthly adjustment amount for high earners, also known as IRMA for short. What this means is that if you're a high income earner, Medicare assesses additional premium for your Medicare Part D benefits. Just keep in mind, the Part D, which is the higher income premium, is an addition to the annual Part B as in boy premium adjustment. And that's determined by formulas set by the federal law. Now, for example, on this chart, you can see for a single individual earning $103,000 or less, or a married couple making $206,000 or less, there's no additional premium. However, if you earn more than the standard amount, there'll be an additional payment you will need to pay. So you pay your Part D premium to your provider, and the IRMA additional you pay directly to Social Security. If you do fail to pay IRMA, you are risking getting disenrolled from your Part D plan if you don't pay in a timely manner. So now that we've gone over original Medicare Parts A and B and Part D, D as in David, I want to jump into Medicare Part C, which is a Medicare Advantage, which is a program Kaiser participates in. Medicare Advantage is taking Part A, B, and D and wrapping it all together into a single plan. So Medicare Advantage plans are offered through an insurance company like Kaiser Permanente. Our Medicare Advantage plan is called Senior Advantage. Medicare Advantage plans are plans that covers all services original Medicare covers. They also provide enhanced benefits like optical, hearing aid, gym membership, benefits that are not associated with original Medicare. So when you sign up for Medicare Advantage plan, you still have Medicare. So again, it's a way of coordinating your Medicare Parts A and B benefits with a form of insurance. This next slide, Medicare wants everyone to know that there's a program called Extra Help, also known as Low Income Subsidy. And it's a program you can apply directly through Social Security for those with limited income and resources, or just having a hard time paying for their prescription or Part D premium. You can apply directly through Social Security. This slide is a high-level overview of the benefits if you decide to enroll onto the Kaiser Senior Advantage Plan. Just keep in mind that in order to enroll onto the Kaiser Senior Advantage Plan, you need to have your Medicare Parts A and B in order to move forward with the next step and enrolling onto the Kaiser Senior Advantage Plan. So this high-level overview of the benefits starting 1/1/2024, the plan out-of-pocket maximum is $1,000 per calendar year. Every time you go see your doctor's office, it's a $5 per visit copay. Telehealth, there's no charge. 11 x-rays, there's no charge either. Outpatient surgeries, it's a $5 per procedure. Hospitalization services, no charge. Emergency services, there's a $5 per visit every time you go into the emergency services. Ambulance, there's no charge. Prescription drug coverage is a really good benefit of $5 per up to 100-day supply for either brand or generic. Durable medical equipment is 20% coinsurance, and there's also eyewear allowance. So $150 allowance every 24 months. Your regular eye exam would be your office visit copay of $5 per visit. This very last slide is contact information for member services, Kaiser member services, Social Security, and Medicare that I want to provide so you could have it at your fingertips.
Thank you for participating in this presentation. We'd appreciate your feedback. Using your smartphone camera, scan the QR code and follow the link to our evaluation. Submit your name, badge, and evaluation to be entered into a raffle. Here are the rules. 1 evaluation/raffle entry per employee per presentation. Winners will be selected at the upcoming information sessions.
Hi, good afternoon. My name is Emmanuel and Morales, and I am from Pathways LA. I am the External Affairs Coordinator, and I will be talking about, well, giving a brief overview of what we do at Pathways LA. Beginning with best practices for increasing communications with providers, all the way to just general information on all our programs. Next slide. So we have a business development corner led by Leslie Ramirez, and this gives information to anybody that is interested in maybe becoming a licensed family child care provider, or is already one. So since we are affiliated with Metro with childcare, we have our Child Development Center at Metro Union Station. But parents, anyone that's interested in becoming a licensed provider, we offer those trainings free of charge. The only time that they would ever have to pay is when they register with the state. Um, Next slide, please. So all our social media, for example, on Instagram, YouTube, we have our Facebook page. TikTok will be coming soon. So anything that we have, we always post it and available for, it's open to the community, our families, providers, especially since now that we're working close with Metro, we post a lot of like the accessibility fairs and the division fairs, like, since they invite us, it's always nice to participate and see like the reactions of all the workers. And I'm not just saying that just because I've gone to them, but everyone is always so friendly, and I love seeing like their smiles, and it's just like everyone gives off great energy. Next slide. Fundraising. So we do a lot of fundraising all over throughout the fiscal year. Some of our companies are our community-based organizations are with First Five LA, Care Connect, Blue Shield of California, Connections for Children. So we do a lot of that for, since we are a nonprofit agency or organization, we will do fundraising, and that also includes like for our staple events, which can also be open to Metro employees or the community, I should say. We have signature events like Winter Wonderland, Thanksgiving, which will be coming up. We have our grand opening for the Child Development Center at Union Station this upcoming, I believe it's on November 15th. So a lot of the fundraising that we do goes to, our events so that we can go ahead and, give back to the community as well. Next slide. Website support for providers and enrollment. So we like when you become like a provider with Pathways LA, or anybody that's interested, or that also goes through the Child Development Center, we provide we have it's called Care Connect, and so that's how they log in, and they can look at the hours, or they can look at if they need to sign for anything. The Child Development Center works a little bit differently, but it's a very similar program that allows them to uh, keep track of their child and their hours, depending on the days, and, from like, let's say 6 in the morning to like 6 p.m., which I believe that's the time that they're open. So we have support for that, and any like of our other programs as well. Next slide. Advertising efforts. So we do have advertisements, like we have them in our different service areas. We serve all the way from Eagle Rock to West Hollywood. So we do have like billboards, and we have radio ads, and we have I believe we also have I've seen like they're meant for like other organizations, but we do have like the little posters that we can take, and we leave them. So we do advertising through many many places. Sorry if I messed up on that. Next slide. Informative videos. So that's something also that we have on our YouTube channel. So we will be having one like for our grand opening, and also like for anyone that wants to do a virtual tour. That's going to be coming really soon. We want parents to know what the Child Development Center looks like, and like some of the staff members as well, and just like kind of like give like a little bit about the curriculum that it offers. It's important that children, are in a diverse environment, and we have whole curriculum for them as well. And it's important also for parents to see who the faces are of the staff that works and will be working with their children. So that's definitely important for us. Next slide. So we have a partner resource directory in addition from either our co-locations with our programs from stage 1, stage 2 or 3, and alternative payments. But if there's parents that are ever looking for resources, especially Metro staff, where we've had a couple where we direct them and guide them and give them more resources that aren't necessarily pertaining to childcare. Sometimes we are co-located with PATH, and that's with housing. So if anybody that's aware of SPA 4, we definitely do have that, and I would encourage them to seek, from PATH or other organizations. And we also are co-located with the Department of Family Services. And that's also open to, like, if there's a case or, anyone. But if Metro employees do have any questions in regards to any of the partnerships or co-locations that we have, they can always give us a call, and we can help direct them where it is that they need to go, whether it's to open like an intake case or just to give them like more information on housing, or, even if they need like diapers or things like that, those resources are available at our agency. Next slide. My name is Emmanuel. I am the communications coordinator, like I stated. My number is down below at 213-651-1646. You can always reach me at my email at emorales@pathwaysla.org, or you can always, come visit our agency. We do validate, so you can park in the structure, and if you have any questions, we're always there to help. The address is listed right there. It's 3325 Wilshire Boulevard, Suite 1100, Los Angeles, California, 90010. Thank you.
Thank you for participating in this presentation. We'd appreciate your feedback. Using your smartphone camera, scan the QR code and follow the link to our evaluation. Submit your name, badge, and evaluation to be entered into a raffle. Here are the rules. 1 evaluation/raffle entry per employee per presentation. Winners will be selected at the upcoming information sessions.
Everybody, thank you so much for attending. My name is Catherine Genta. I am a senior account manager from ComPsych, your employee assistance and work-life provider. So I'm excited to be here today and share some information with you on your guidance resources, EAP, and work-life program, and all the ways you can make the most of these free and confidential services. Next slide, please. First, a quick overview of ComPsych and who we are. ComPsych is the largest provider of employee assistance programs in the world, and we are the pioneer and leading provider of fully integrated programs, such as the program model that Metro Los Angeles provides, which we're going to be talking about today. We have been partners with Metro Los Angeles since 2004. ComPsych is the name of our company, and Guidance Resources is our brand. We call it Guidance Resources because essentially that is what we do. We connect people with resources and provide guidance on a wide variety of life needs. That's important to keep in mind, as the name of our website is guidanceresources.com. You may also hear to your program referred to as Guidance Resources. So now when you hear that name, you know that it is referencing your EAP and work-life program. Next slide, please. This next slide talks a bit more about integration. Your Guidance Resources program goes beyond offering short-term counseling, although that is an important component of what we do. In addition to that, Guidance Resources can also assist with offering legal and financial support and resources, and connecting you with information and referrals to support your work-life needs. And the reason that we offer this integrated program model approach is because we believe that many issues that people experience in their lives are interconnected and can impact many other areas in life. Take, for example, in the case of a divorce or separation, someone may benefit from seeking some short-term confidential counseling. That same individual may also benefit from legal and/or financial guidance or consultation during that time as well. In addition, perhaps a change in childcare or daycare arrangement might also be needed. In that example, this program can be a single source to support with each of those needs. Next slide, please. It is important to note that this program is strictly confidential. We do not share individual records or information of any kind back with your employer. We do provide reporting, and the reporting we provide, it's just in aggregate numbers to show how many people are using the service. So rest assured, when you call in, the fact that you call in and the reason that you called will be kept entirely confidential. Next slide, please. This slide is a little bit more about access and eligibility. Your program is available 24 hours a day, 7 days a week via your program's dedicated 800 number that you see there on the slide. The program is available to all Metro Los Angeles employees and your household family members. So in other words, anyone living under your roof as an employee is eligible to take advantage of these services. You can also access services via our website or mobile app, which we're going to be talking in more detail about today as well. Next slide, please. Your Guidance Resources program includes access to short-term confidential counseling services. This would be a great resource for anyone looking for someone to talk to as they're going through a life change, guidance around work-life issues, and really anyone looking for practical coping and stress reduction skills to help manage life's challenges. Your program includes 3 visits with a local provider in your area. These sessions are available per person, per issue, per year. And there are several ways you can engage in counseling services, whether your preference is face-to-face or virtual by means of telephone, video, or chat. So simply put, think of the benefit as 3 visits per each issue that you might have. And there is a distinction on the slide between EAP, which is intended to support short-term counseling, and long-term counseling for things like continued treatment, medication needs, long-standing issues, and that's really best to go through your insurance. If you're not sure, it really doesn't hurt to give our program a call. Your first point of contact will be with one of our master's level clinicians who you can speak with, and they'll help get you connected to the right level of care. Next slide, please. In addition to short-term counseling, your program also offers unlimited telephonic access to one of our licensed attorneys who can assist with providing information on a variety of legal matters such as family law, wills, and real estate. If in-person consultation is needed, we will connect you with a local attorney, and you will receive the first 30-minute in-person consultation free with a 25% reduction in fees thereafter. Next slide, please. Similarly, your program offers unlimited telephonic access to financial information and consultation with our team of CPAs and certified financial planners. Our financial experts can help provide confidential and objective guidance on a variety of financial matters such as debt and money management, budgeting, income tax questions, and retirement planning, just to name a few. Next slide, please. You can think of work-life services as a way to get personalized assistance with crossing off your to-do list, whether that be event planning for a wedding or vacation, assistance with apartment hunting or relocation. Maybe it's something like finding a vet for your new pet, or options for summer camps or daycare for your kids. Maybe you're expecting your first child or are interested in going back to school. The list goes on. What our team says, as long as the need is ethical and researchable, our team of work-life specialists can assist. This is a very approachable entry point into the program. There's probably something on all of our to-do lists that we wouldn't mind getting a little bit of personalized assistance. and seeing how the program can support you and seeing what that experience looks like. So definitely encourage everyone to give this service a try. Next slide, please. Guidance Resources Online is your online resource to connect with your employee assistance and work-life program. Access thousands of resources, videos, podcasts, quizzes, slideshows on a wide variety of mental health and work-life topics. There's also some great ways to get connected with care on Guidance Resources Online if that's more convenient for you. Under that Connect to Care banner that you see here on the screen, there's a reminder of your program's dedicated 800 number if you do wish to call in. You can also go through the process of booking your first appointment with a therapist through that Guidance Connect tile. So a really great option to schedule find a provider and schedule that first appointment, all without having to pick up the phone. Similarly, you can get in touch with our work-life services, the work-life balance, the legal, and the financial through that third option. You can chat with one of our master's level clinicians, and also always the option to send in a question as well. So tons of virtual options there. Next slide, please. Guidance Resources Online is also available to you on the go through our mobile app, Guidance Now. So everything I just described about Guidance Resources Online is available through this mobile-friendly app, and really encourage you to give this a try. There'll be a couple QR codes on the last slide where you can hover over and easy access to download the app. It's really a helpful tool to have all the program information with you on the go. Next slide, please. Here is a reminder of your program's dedicated 800 number. You can use this number in order to access any of the services that are available in your program that I talked about today. GuidanceResources.com. If it is your first time logging on, you'll want to register with your company ID as shown on the screen. And then, of course, our mobile app, Guidance Now. If you hover over those QR codes, you'll be guided to a place you can easily register for the mobile app and have that with you on your phone. All right, the final slide here is a copy of our FAQ. So frequently asked questions about the Employee Assistance Program. This is helpful, certainly if maybe you haven't used the program before, or maybe are looking to learn more about the program. A helpful guide to reference some of these questions about the experience and what to expect before calling in. Certainly would always encourage you to, even if there's just a question you have about the program or you're just interested in learning more about the program, please don't hesitate to give us a call anytime. Again, that number is available 24/7, and that number is always answered live by one of our master's level clinicians.
All right, so that is the final component of your presentation. If you would like to wrap it up, and then we can end the recording.
Sounds good. And that concludes our presentation today. Thank you so much for your time and for your attention. And please let us know if any questions come up and anything that we can do to support or assist you. Thank you again for your time, and have a great day.
Thank you for participating in this presentation. We'd appreciate your feedback. Using your smartphone camera, scan the QR code and follow the link to our evaluation. Submit your name, badge, and evaluation to be entered into a raffle. Here are the rules. 1 evaluation/raffle entry per employee per presentation. Winners will be selected at the upcoming information sessions.
Good afternoon. This presentation is planning for prevention regarding respiratory virus season. Next slide, please. Again, my name is Collins Kadu. I'm the interim Deputy Executive Officer for Corporate Safety, and I'm going to be doing this presentation. I'm going to review the objectives, what we will accomplish. Number one, We want to reduce the risk of severe illness this winter and to minimize disruptions to daily activities. Next, please. When we talk about respiratory virus season, we are talking about three illnesses, COVID-19, cold or flu, and respiratory syncytial virus, or what we call RSV for short. Next, please. So we'll look at the symptoms. Again, this is a review for most of us. We have gone through the COVID-19 pandemic. Again, I just want to go over the symptoms, just in case if somebody's feeling any of these symptoms, to get tested or consult their physicians. COVID-19 symptoms include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches. Next, please. Headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. Next, please. So I'm going to go over the cold or flu symptoms. Fever, cough, sore throat, stuffy nose, body aches, headaches, fatigue. Next, please. So I want to go over the RSV symptoms. Runny nose, decrease in appetite, coughing, sneezing, fever, wheezing. Next, please. Irritability, decreased activity, breathing difficulties. Please call your health care provider right away if you or your child is having difficulty breathing, not drinking enough fluids, or your symptoms are getting worse. Before I continue, I just want to highlight the symptoms that are common to all those three viruses. These are what we call the symptoms are fever, cough. Those are the common symptoms. Difficulty breathing, cough, fever. Next, please. So I want to talk about the prevention. Again, this presentation is about preventing those three viruses, in this winter, coming off into. Number one, get up to date on vaccines now. You don't have to wait until you get the symptoms. Transmission of COVID-19, flu, and RSV typically increases in the winter months. And this is why we encourage people to get vaccinated as soon as possible. Flu and update COVID vaccines are recommended every 6 months. These vaccines can be administered together. Again, you don't have to make three trips. You can get them at once. Consult the Los Angeles County Department of Public Health for site. Also, we encourage people, even though masking is not required, but we have seen that it can prevent infection. So masking is one of the ways to prevent being infected. Next slide, please. Prevention continued. Cover your coughs and sneezes with a tissue, or cough or sneeze into your elbow, not your hands. Wash your hands often with soap and water for at least 20 seconds. Avoid close contacts, such as kissing and shaking of hands with others. Stay home from work or school when sick until symptoms improves. Avoid sharing cups and eating utensils with others. For RSV, clean frequently touch surfaces. I want to point here that during the COVID, we found out COVID was transmitted through breathing, respiratory, rather than touch. So, but for RSV, it's transmitted through touching contaminated surfaces. So frequently clean, clean frequently touched surfaces. Next slide, please. Flu vaccination. Flu vaccination has been shown to reduce the risk of flu illness, having to go to the doctor or hospitalization and death. So we encourage people to get vaccinated, this season. Next, please. So that's all I have. Again, if you have any question, you can contact us at this phone number, 213-922-4970. Thank you so much.
Thank you for participating in this presentation. We'd appreciate your feedback. Using your smartphone camera, scan the QR code and follow the link to our evaluation. Submit your name, badge, and evaluation to be entered into a raffle. Here are the rules. 1 evaluation/raffle entry per employee per presentation. Winners will be selected at the upcoming information sessions.
Hi, my name is Terry Holman, and I'm here to tell you about the Employee Rideshare Program today. Next slide. What is the Employee Rideshare Program? Well, it's a program that Metro has to assist you with your commute to and from work. Next slide. What are my options if I choose to participate? We have a monthly pass option for employees to take non-Metro bus or rail. And when we refer to rail, we refer to Metrolink, and bus is any non-Metro bus such as LA Dot, AVTA, Foothill, Long Beach, etc. We have a van pool program where we will pay for your seat to ride in a van pool. And we have a bike incentive. Next slide. We also have a Metrolink reimbursement program for employees that telecommute. So for employees that are interested in taking the Metrolink train to work, but they are not in the office enough to qualify for the monthly pass, we have a Metrolink reimbursement program for them. And we also have a bus tap stored value program. And the bus tap stored value is open to any employee, and you can request up to 4 to 12 days per month. So it's just like sort of like the Metrolink reimbursement program, where if you cannot take the bus to work enough to qualify for a monthly pass, you also have this option. How does the program work? Well, for monthly pass holders for bus or rail, we load your pass electronically monthly, and you also sign for it electronically via email or text. And when you sign for it monthly, you're agreeing to the terms of the program. Next slide. More flexible back. Oh, how do I enroll? Well, for the monthly pass and tap store value programs, you need to submit your application by the fifth workday of the month prior. For example, if you're interested in receiving a monthly pass for December, you need to submit your application by Tuesday, November 7th. Next slide. How do I enroll? Continued. Metrolink reimbursement. For employees interested in the Metrolink reimbursement, you submit your request monthly by the required deadlines that are provided on the right of this slide. Next slide. What are the benefits of ride sharing? Well, if you ride share, you'll save money and time on your commute to work. It will reduce your stress level because you're not going to be sitting in traffic, and you're also reducing your carbon footprint. Next slide. It will also save you money. On this slide, here's some examples. The average cost of a 50-mile round-trip commute to work if you drive alone costs $9,817 annually. And if you choose to ride share, and let's say you have a 20-mile round trip to the park and ride where you park your car to take the bus or train, it will cost you approximately $3,927 annually. Next slide. Reduces your stress. Let someone else do the driving for you. And you'll also get exercising walking to the bus or train. Next slide. Reduce your carbon footprint. Transportation is one of the biggest contributors to greenhouse gas emissions in the world. So be kind to the planet and give ride sharing a try. Next slide. Well, I wanted to thank you for listening to my presentation today. And if you have any questions, my contact information is here. Thank you.
Thank you for participating in this presentation. We'd appreciate your feedback. Using your smartphone camera, scan the QR code and follow the link to our evaluation. Submit your name, badge, and evaluation to be entered into a raffle. Here are the rules. 1 evaluation/raffle entry per employee per presentation. Winners will be selected at the upcoming information sessions.
Hello and welcome to Employee Savings Tickets. We are the fun side of your benefits program. We like to consider ourselves as our ticket to fun. If you haven't used our program yet, it is available to you at any time. It's available 24/7. All you need to do is just go onto our website at est.us.com and enter your access code, which is Metro Fun. Now, in order to purchase tickets, you will have to create an account, and it's very, very simple. You just go to the purple bar on the top right, click on login, or hover over account, click on login, and under new user, create your account. In order to help us get your account activated quicker, it'd be easier to if you use your company email, your Metro email. You can change it after if you want. It's not a problem. And then once the account is created, we will send you a confirmation once the account is activated. And then you can go ahead and log in, and then you'll be able to view all the wonderful tickets that we have. And we have everything from movies to zoos, aquariums, theme parks, concerts, major league sports. If you want to go to a Rams game or a Chargers game or even the Raiders, you can buy your tickets directly through our site. And we also have rental cars. The hotel program is pretty awesome. I do have 2 different hotel programs in there. And the reason why I did that is because we want you to shop it. We already know that it's better than like an Expedia or hotels.com, but we want you to have a choice. So feel free, click on both of them. One of them is a cashback hotel program. And how that works is that you do get a cashback or credit back to your credit card once you have stayed there. So it doesn't automatically discount it when you place the when you make the reservation. It's once you've stayed at your resort, then it'll automatically credit back your credit card. The other one is the EST travel program, and the EST travel program, when you click on that, it has two different programs in there. One is a hotel program, and it's pretty cut and dry. And then the other one is where you can see your rental car. Now we have other stuff as well too, and we have like 24-hour fitness. We have you can even buy discounted perfumes and colognes and all that stuff. There's just a whole variety of different things that you can click on. We are working on adding even more stuff. So as the venues start getting better about releasing discounts, we'll start adding them on. And we are in a process right now of implementing some development on our website that's going to allow us to really expand. So in this next few months, you probably will see a lot more discounts in there. In the meantime, we do have Disneyland. Disneyland right now, unfortunately, we do not have a single day ticket, but we do have a discounted ticket for a 2, 3, 4, or 5-day ticket. Now, one important thing to know about Disneyland is that when you buy a 2-day ticket, you have 13 days to use the second day or third day or fourth day or whatever it might be from the initial visit. So make sure that both dates that you want to go are available. Their holiday events start on November 10th and they go through January 7th. Now, most of the parks are going to have their holiday events starting up here pretty soon in the next couple of weeks. Legoland, theirs start a little bit later, November 18th through January 7th. Universal Studios, November 24th through January 1st. Knott's Berry Farm or Knott's Merry Farm, November 17th through January 7th. The San Diego Zoo is more of a shorter period, which is December 9th through January 1st, and that's called Jungle Bells. Kind of cool. SeaWorld's Christmas celebration is November 17th through January 7th. And then for any of the other ones, you can click on the landing page, and we'll be able to tell you which where they're at or when they're starting. One of the other venues that we have, or one of the sources that we have, is through an affiliate program called Ticket Network. And the Ticket Network allows you to purchase discounted tickets to through to concerts, sporting events, plays, theater, stuff like that. One of the more recent updates that we have with the Ticket Network is that we do have tickets for the new Las Vegas Sphere featuring U2. So that is really cool to have. There's some upcoming concerts that are coming up as well too. Chris Stapleton, Mariah Carey, Blink-182, Bad Bunny, Leonard Skinner, and it goes on. The list goes on and on and on and on. But we are here to help you out. If you have any questions, you can always give us a call at 310-316-3115. We'll be able to answer any questions you might have. And yes, we are available 7 days a week. If you don't get an answer right away, we will just leave a message and we will call you back. You usually call back within 5 or 10 minutes. If we don't answer, it was probably just because we're on another call. But I hope that for those of you who have been using the site, that you are happy with it. And for those of you that haven't used it yet, we welcome you to the Employee Savings Tickets, and we look forward to working with you soon.
Thank you for participating in this presentation. We'd appreciate your feedback. Using your smartphone camera, scan the QR code and follow the link to our evaluation. Submit your name, badge, and evaluation to be entered into a raffle. Here are the rules. 1 evaluation/raffle entry per employee per presentation. Winners will be selected at the upcoming information sessions.